So a very good evening to all of you. So let me request you to kindly enter your name and your iSafe number for those who are members of the iSafe. Others may kindly enter your name and designation. And we'll start the meeting in another 2 minutes. So a very warm good evening to all of you and welcome to this very important meeting of Indian Medical Association's iSafe. Now we are joined by a galaxy of distinguished personalities today, and we feel very proud and happy to invite all of you to this very, very important function. Now at the outset, let me request our State Secretary of IMA PEPS, Dr. Cyriac Thomas, to kindly offer the welcome address.
So good evening to all. Today we are coming out with yet another launch of iSafe initiative against COVID control. In fact, we started this almost 1.5 years ago, and we are still continuing. We don't know how much time again we will be going through this. Today's meeting will be inaugurated by our Honorable Minister for Health, Srimati Veena George. And on behalf of IMA Kerala State Branch and on behalf of all who are present here, let me extend our warm welcome to our Honorable Minister. We also have our State President and State Secretary, Dr. P.T. Sakriya sir and Dr. Gopi Kumar sir, who are guiding us in our day-to-day activities. Our hearty welcome to our leaders. Now let me welcome Dr. Dilip Kumar, General Manager of KMSCL, for accepting our invitation, and he will be enlightening us about the vaccine rollout through KMSCL. Welcome, sir. Now let's welcome Dr. Ilangovan IAS, Principal Secretary of Industries and Commerce, as well as NOCA Chairman. He'll be talking to us regarding his new publication, Creating Values in Healthcare. Now, let's not forget our sponsor from Singapore, represented by Mr. Prem and Mr. Srikanth, for making, actually, without their efforts, this event would not have materialized. Thanks a ton for all your efforts. And let me extend our hearty welcome to today's program. Now let's welcome our speakers today, Dr. Sejit sir and Dr. Altaf, who will be talking to us regarding the current guidelines and the management strategies. Welcome, both of you. Now we also will be having a launch of Covino Mask today. And I also welcome our chairman, Dr. Sijiten Kumar, who actually creates these ideas and makes them happen. Sincere welcome to Dr. Sijiten Kumar. Now let me welcome our PEPS team, as well as ISAFE office bearers, also office bearers of MSN and all our office bearers, as well as staff to today's program. Finally, my hearty welcome to all the ISAFE members and all those who have joined here to make this program a success. Welcome all.
So thank you very much, Dr. Cyriac Thomas. In fact, we are so happy and proud that all our distinguished leaders and very senior and esteemed colleagues have joined us. In fact, Ilangovan sir is the principal secretary of two very, very important departments. But more than that, for us, he is our own elder brother, because he belongs to our fraternity. And right now, he has come out with a tremendous book, which will be introduced shortly. Now, let me request our state president, Dr. P.T. Sakriya, who is our guiding light, to kindly offer the presidential address.
Thank you very much, Sri Kumar, Cyriac and Madhu, and all PEPS leaders and others, assembly here. Dr. Joseph Pani is there. Many IMA strong top leaders are also there. IMA State Secretary has joined, it seems. This is a rare occasion that when during the first and second wave, about 1,548 doctors died in India. Most of them are GPs and very young doctors. They have not settled in their life financially or so. So we are, our national president is there to help them for each family immediately 1 lakh rupees. That is a COVID martyrs fund is collected from all over India, and our Kerala state itself donated 10 plus 10, 20 lakhs rupees, and other plus the branch contributions directly paid to him, to the national president. Now it is when we compare this, 1,548 doctors died in all India level. What happens in Kerala is due to this ISAFE program. I have no deliberations or hesitancy to tell about ISAFE, because we have in the right time we started training our doctors who is practicing in various hospitals, small hospitals, how to conduct triaging and how to conduct other air circulation, about air circulation, even engineering aspect we covered. And I believe that it is because of the ISAFE training, most of our doctors are not dead by this time of the second wave. Number has again raised above our calculations. The second wave is there, and we are still fighting to control this second wave. Anyhow, it's a political decision that the restrictions has to continue, but we have got our own idea, and I am not going to that topic in deep now, because Sreet is there. We invited so many people, and respected health ministry is there, and our industrials and NORCA secretary, Dr. Ilangovan IAS. He's a very great personality because he was health secretary before. I had been with him, we discussed with him in Alleppey Collectorate and through online during the H1N1 period of early days Elangovan was very smart and he was helping us. Whenever IMA calls him, he will attend the meeting on behalf of his advisors, with his advisors, and also in epidemic control also he is number one. Now he is handling two very important departments, as Dr. Srijit N. Kumar told, that that is an excellent time for him, and he is going to publish a book about the values of, I don't know, he himself will tell that. I have not seen that book. Launching our Covina mask is another specialty of our ISAF now. They have collected this mask from Amrita Hospital, and this is N95 mask we are recommending, but this also is as good as that. They have studied, they have research team, ISAF, they have studied, and they have their own mechanism to test this before distribution. And I congratulate Srijit N. Kumar, Siriak and Madhu and all our ISAF leaders, and also Dr. Krishna Kumar and other IMA senior leaders in this audience. I have to thank our health minister also for committing regarding this, participating in this meeting. She is also a very friendly health minister, and we are going to support her in the future. Okay, also to become her ability, our capacity is so successful in health department. And there are nothing will happen free in this world. So Singapore people, doctors as well as public, collected some important things to be distributed through PEPS, and I am not going to detail that thing. I congratulate PEPS go to start this ISAF program again with new ideas, and also respectful health minister and respectful former health secretary and present industries secretary for attending this meeting in time. Thank you very much.
Thank you.
So thank you very much, Secretary sir. Ilangovan sir is actually too busy today. He was personally coordinating the minister's meeting himself. But in spite of that, he agreed to be present with us. Health Minister's office is in touch with us. She will be joining. She's in a meeting with Chief Minister. So either she will join us or she will send a message very soon. So we'll wait for that. But we'll not keep Ilangovan sir and all the audience waiting, because sir is creating a revolution. Now, while he is the principal secretary and a very, very senior respected officer amongst IAS, his passion is always in medicine. We have always felt that whenever we go there, he takes a lot of interest in discussing about his specialty. He is very proud that he is an orthopedician. He keeps operating. He also has a PhD from the Indian Institute of Technology, a very passionate, ardent fan of health, and a very able administrator. So we are very delighted that we have Ilangovan sir today. He is the principal secretary of industries, and also he heads the NORCA, which I think would make our Singapore colleagues also happy. And sir had been instrumental in facilitating many ventures of Indian Medical Association and PEPS. And during the recent pandemic, many of our efforts through the foreign institutions did happen under the direct guidance and supervision of Ilangovan. So we have no words to thank you, and we are so very proud that you are creating a revolution by imbibing and into the medical fraternity the true values in healthcare. So Ilangovan sir has just published a book, Creating Values in Healthcare, which was published by the Honorable Chief Minister. And Ilangovan sir is here to brief us briefly about the book. And thereafter, IMA and PEPS would take up to get it across to the medical fraternity. And if you need the book, do contact us, and we will facilitate the dispersal of book, especially in the medical fraternity.
Okay.
Thank you very much, Ilangovan sir, for joining the occasion. And now over to you. You can unmute. You're a co-host. You can unmute.
Yeah.
And there is, meanwhile, I'll share the.
Okay.
I'll share the front page of you.
Thank you so much, Dr. Srijit N. Kumar, Dr. P.D. Zakaria, the President of IMA Kerala, Mr. Siriak Thomas, Secretary, iSafe initiative, Dr. Gopikumar, Mr. Krishna Kumar, and members of the PEPS team, iSafe Kerala, and entire IMA fraternity, and all the distinguished medical practitioners across the state. It's been a wonderful evening. As Mr. Srijit said, I always enjoy talking to my own people. Despite the fact that I'm in administrative service, whenever I had a chance to study, to talk, I always take a lot of pleasure because healthcare is very close to my heart. That's the reason why, despite being in the service, I could manage and do a PhD from IIT Madras on healthcare. At the outset, let me place on record my deep sense of appreciation for allowing me to come and do a small interjection about the book which I recently been published. I'm also delighted to know that the Singapore Malayali Association or the community have been so deeply involved with the motherland initiatives, and they have been responsible for this event to take place. So my personal as well as a secretary in NORCA, my thanks and gratitude to both Mr. Prem and Srikanth. If time permits, I will certainly carry these good things to the Honorable Chief Minister, that the medical fraternity across the globe are united in ensuring that people in Kerala are safe from the COVID things. Kerala, you know better than me in the sense we always had ups and downs in this COVID management, but the inputs from IMA has always been very critical and crucial for us. I used to be a member of the COVID management team, and we always used to feel what IMA talks about. It makes a lot of sense because as a science student, my message being a doctor, so I was very successful to say the least, to get across to the chief secretaries on the issues. Even now they consult me very informally, although I'm not the health secretary. Now, I had a very brief statement on my book. As all of you know, that healthcare services were never been discussed like today, anywhere in the recent past. COVID has actually shook the human conscience, deranged economies, and disrupted life, and killed many people. Millions have perished across the globe. One of the worst pandemics in our time. What, to my mind, this pandemic has actually thrown upon is that the resilience, what it should be in the healthcare system, was put to challenge. And the supply chain management of hospitals have totally gone haywire, be it oxygen or some other thing. So, the healthcare as a whole is something which has faced a huge challenge. Doctors worked almost to the edge of collapse. And as Dr. Zakaria very rightly said, very sadly we lost many of our colleagues, mostly young people in the first wave, and not many so in the second wave. But India lost several prominent, respected citizens. That's a bitter lesson we have learned. So this book is about what? This book has been my passion to say what really creates a better clinical outcome or a better patient outcome. It's a huge topic. No one author can say this leads to this. It's a plethora of suggestions, plethora of theories, plethora of opinions. The philosophy which I actually pursued in IIT Madras is that doctors are the decision makers in healthcare. Doctors play a very crucial role. So I looked at how physicians are satisfied while discharging their duties. A satisfied physician, to my mind, will give is best to the patients. Unfortunately, the healthcare system, be in private or in public, is not actually catering to physician needs. The physician needs are very minimal. What he wants is a recognition. Do the system recognize a physician for a duty which he has done beyond the duty or beyond the call of the duty? So the philosophy was pursued. I have interviewed more than 482 people, all practicing physicians across Tamil Nadu and Kerala, and came out with a very huge study which said that physician satisfaction leads to clinical outcomes, better outcomes. So it's a beautiful theory which I actually profounded. I have identified 7 things which are physical factors like infrastructure, leadership, governance, physician focus, and patient focus, process focus, and information management are these attributes that can improve the clinical outcome. But all these act through the physician. They all act through physician. A satisfied physician will lead to a better patient satisfaction and a better clinical outcome. This is the theory which has been proved by statistical studies. Therefore, physician is now a center of the universe in an hospital. A system that recognizes physician, a system that caters to physician needs will definitely create a satisfied physician and thereby a better clinical outcome. Now, there are three models I described in the book. When we were studying probably, we had a model called trust model. The physician and patient relationship is mainly based on trust. The diagnosis was made mainly by intuition. I was taught in medical college by my professors that you should be able to diagnose only by inspection, 90%. Auscultation is only 2%. So your trust model was there for a long time. Due to huge pressures from the paying agencies such as insurance companies in the West, this trust model, which had a huge asymmetry of information between the doctor and physician. This asymmetry of information led to several problems. So the companies which are paying for the services said, we must now move out to evidence-based model. So you treat the patient only by evidence, not by intuition, not by your experience, not by your mind. This has become expensive because evidence-based treatment, evidence-based model will have investigative approach. Therefore, the treatment cost has become exorbitantly high in the Western world, also in India, largely. Now, all these people have felt that even after going by the evidence-based model, patient satisfaction is something that is a big miss. A cured patient may not be happy because he had to pay a huge bill in the hospital, or a sick patient, or due to a catastrophic event in the family outcome, will not like healthcare what they received. Therefore, the new concept has come. It's called value-based medicine. So what does this value-based medicine says? Now, while physician is in the center of decision-making continuum, value-based medicine also puts the patient in the center. It is the physician-patient interaction that creates value for the patient. Essentially, what I'm saying is patient engagement and patient partnering with the doctors. I heard a case study of Cincinnati Children's Hospital, where in the grand rounds, patient attenders are taken in the rounds. Because the children's hospital, father or mother, a relative, and a social counselor attends the rounds. So much of socialization of the grand rounds takes place in several parts in the West. So my value-based is what, I'll end it here. My value-based model has got a simple prescription. It has got three elements. One is value comes when there is appropriateness of the care. Appropriate care. Second, value comes when patient is involved in the decision making. If these two are there, then what matters next is the cost of treatment, affordability. So I call appropriate care plus patient satisfaction divided by the cost of care. For every 1 rupee I spent, what is the value? So here, appropriate care actually takes care of all the medical errors, unwanted diagnosis, unwanted medicines, etc., etc. So I am suggesting that there should be standard care pathways to act as a template. It cannot be a Bible. Every physician has to modulate the treatment based on the patient. But there should be a standard care pathway for majority of the major diseases. Second, patient experience can come only if we involve the patient. Involving the patient comes before hospital admission, during hospital admission, and post-admission. I always keep quoting the case history of Indigo Airlines. Now, how did Indigo Airlines actually swayed people from other airlines? If you see Indigo Airlines, if you book on Indigo Airlines, by the time you start booking, even after you leave the plane and go home, there's a continuous message going up and engaging you. So do we do that in an hospital? If we do not have time There are a lot of technology to do that. Triggering messages to patients now and then. So constantly engage a patient, his satisfaction will go up like anything. Decision making, and now leave the choice to him. In difficult situation, leave the choice. Acceptance is better of the outcome. So it's a huge chapter on patient satisfaction. Now, what is affordable care? Affordable care, according to study, 60% of the expenses we incur on medicines and 40% on the diagnostics, around 27-28%, rest are on the consultations. So while India being the largest exporter of generic molecules to US, why is that we don't have generic system here? Because doctors have genuine concern of the quality of generic drugs. So my book prescribes that government should invest in large number of drug testing laboratories. When I was health secretary, I found out at that point of time, Kerala alone, 240,000 batches of drugs were sold. 240,000 batches. And at that time, we had capacity to test only 15 to 18,000 samples, batches. So that would actually have motivated people to, might have motivated to put spurious drugs or substandard drugs. So government should invest hugely on the testing lab to ensure that, because US, the same generic molecules sent from India are used in the US hospitals. There's a study which says that $100 billion was saved by switching off from branded to generic medical. So government should do everything to increase the list of essential medicine and put on the price control order so that the people at large, people who are poor, people who are in the middle income really get benefited. So affordable care comes in as a very important element. Therefore, ladies and gentlemen and my dear friends, creating value is in the hands of physician. Nobody else can create value in a healthcare. But physician is today busy. He has no time. He cannot spend more than 5 minutes or 10 minutes in a public hospital. Even in private setup, he cannot spend if you become a famous. Therefore, how do you actually modulate your practice? How do you create a standard care pathways? How do you automate the process? How do you engage the patient from beginning till end? And how do you ensure that affordability is one of the elements? This in short explains my book, which is basically to bring value. I have developed a value matrix, which is very useful for people to understand. 5 grades. I have also developed a conceptual model for hospitals to adapt what creates what. And I also developed a value-based medicine circle or a big diagram, 20 things that brings in value for the patient. I hope the learned community will be able to understand and accept my suggestions. If not, I stand a trial and scrutiny in any other forums. That is always there. It's a pleasure talking to every one of you. Thanking once again Dr. Zakaria and Dr. Srijit and everyone who spoke before me for giving the opportunity. I will stay on. I'll switch off my video. I'll stay on. I would like to hear what is ICF lectures are going, because that will be huge learning for me. And if I learn this probably in one of the communications with my higher ups, certainly these things will actually get on to the decision makers. So with these few words, I thank IMA once again, and I look forward to another opportunity of giving a long lecture to you on the book, and I'll be very, very happy. Thanks once again, and nice seeing you all after a very, very long time. Thank you so much.
You are welcome anytime, sir.
Thank you. Thank you so much, Dr.
Thank you, sir. Thank you very much.
Thank you very much, sir. It was indeed an excellent and exciting lecture. And in fact, you have just, made us all very, very inquisitive. So we are not going to leave you. We are definitely going to take you to a national forum. We'll have because this is something which is very, very dear to IMA. Our great leader, Dr. B.C. Velayathan Pillai, always talked about values and quality. So we'll take it up in a national forum. And we'll invite all our national leaders, and we will be extremely grateful if you can come there, and we will take it up as a national level, and we will also imbibe it as a model in Indian Medical Association. We have our great leaders, Babu Ravindran sir is there, PT Secretary sir is there. So all of us, Joseph Mani sir is there. He is the next national vice president. So we'll definitely take it up, and thank you very much, sir. Thank you very much for the very passionate lecture. Thank you very much. Now, let me request our State Secretary, Dr. P. Gobikumar, to kindly address us. And thereafter, I'll request the General Manager of KMSCL, Dr. Dr. Dilip Kumar, who again is very, very kind to us to talk. So first, over to you, Gopi Kumar, sir.
Good evening. Thank you, Dr. Sri. Respected State President, Dr. K.T. Sakaria, Dr. Ilangovan, sir, Honorable Minister, Dr. Dilip Kumar, senior IMA leaders and friends. Actually, iSafe and PEPS have been doing human service to the healthcare workers as such. Now, when the COVID pandemic hit 1.5 years ago, IMA had just two ideas. One is protect ourselves and then protect the community by giving out guidelines. So we were doing these two aspects in a very efficient way during the first wave and even during the second wave. And that is where iSafe has come out with. Probably Kerala is the only state where the hospitals were not closed during the COVID pandemic. All the hospitals, including small and medium hospitals, were open within a fortnight of the start of the COVID pandemic, because of the efficient training of the healthcare workers, including doctors, by iSafe and Indian Medical Association. We have been training them, updating the knowledge, the various methods to have self-protection, and also providing equipments and materials for infection control and other things. And I take this opportunity as the Indian Medical Association State Secretary. We are very much grateful to Dr. Srijit, Dr. Siriak and team of iSafe for bringing up this particular project, which has definitely cared the healthcare workers, including staff nurses and the other hospital workers. We had been training them. And now in the second phase, we had started training the small and medium hospitals to take care of COVID patients. That also we have started. And as part of that, we are coming up with these new projects one by one, of course, with the help of various good hearts from Singapore, from the Middle East, from the US, everywhere. Our fraternity everywhere has been helping Indian Medical Association and iSafe, and we are very much thankful to them. Definitely, we will carry forward this movement, this project, so that every one of us are safe in this COVID pandemic. Once again, congratulating iSafe and the team. Thank you very much.
Thank you very much, Gopi sir. In fact, we are extremely grateful for all the great support which Sakriya sir and yourself had been, pivoting from the headquarters, but for which this wouldn't have materialized. So thank you very much for that. Now, dear friends, we have Dr. Dilip Kumar. He's a young but very energetic and very vibrant leader of the medical profession. In fact, he has transformed the KMSCL, and Dilip often astonishes all of us by his tremendous inputs. He was very, very kind to offer vaccinations, Covishield vaccines for the private institutions, and I think I hope that this will be a beginning of a great association between Indian Medical Association and KMSCL, because he will be also able to probably give us equipments, other equipments, and even maybe drugs like what they give through Karunya, through the small and medium institutions of our iSafe network as well. So I have great pleasure in inviting our dear brother of our own fraternity, and we are very, very proud of you. He's doing a tremendous job in KMSCL, and now he'll be briefing us about how the vaccine will be provided to all the small and medium institutions who require them, and how it is to be processed, and how you can procure that directly from the KMSCL. Over to you, Dr. Dilip.
My own respected mentor, Dr. Ilangovan IAS, because sir was the Secretary Health when I joined Kerala Medical Services Corporations. Honorable Minister, my senior officers, teachers, senior leaders of IMA. So it is my prestige and privilege to be here, one among you, to have a small introduction regarding the Kerala Medical Services Corporations, in which I am doing my present profession. So it is an honor to be here. I do take this opportunity to express my vote of thanks and gratitude to Indian Medical Association, because you have been the pillar behind health department whenever we have been working together in the midst of COVID, in the midst of Nipah, in the midst of flood situation. We have been coordinating to and fro regarding all the activities for providing comprehensive healthcare, which is of good quality, by reaching out to the beneficiaries to the max. So I take this opportunity for sharing my vote of thanks for all the coordinated efforts what Dr. Srijitan Kumar, Dr. Sulfi, and our senior leaders have been doing with KMSCL. I am taking this platform to introduce one of the novel initiatives of the state of Kerala for enhancing the accelerated vaccine campaign against the COVID-19, which is one of the dangerous epidemics for the time being. As all of us know, almost 2.87 crores of beneficiaries are there in the state of Kerala for getting vaccinated against COVID-19. As of now, we have almost reaching 75% of first dose, and we are in the 30s to 40s for the second dose. Honorable CM has suggested as an initiative, for extending the vaccine support through private sectors by having 2-3 thoughts. I think Dr. Ilangovan sir was one of the great pillars behind Honorable CM's direction by giving the technical inputs for taking this novel decision. So the initiative was in such a way that KMSCL will be the aggregator for the procurement of Covishield vaccine on behalf of state of Kerala. In the sense, for large and medium scale institutions, especially in the private sector, they were having opportunities for getting that vaccine directly from the manufacturer. But the small scale private clinics, which were always there in the front forefront for providing comprehensive healthcare, always was having some hurdle in getting Covishield vaccine, since there were some constraints for the procurement over a larger scale. Initially, there were guidelines saying that 6,000 will be the minimal dosage that has to be ordered by the hospital for getting the vaccine. Later on, it was reduced to 3,000, but still, small scale institutions was not there in the opportunistic level for getting the support whenever they are in the verge of getting vaccinations. Now, through this initiative of creating KMSCL as an aggregator, state has already empowered KMSCL for procuring 10 lakhs doses of Covishield vaccine in the first step. Later on, we will be thinking of procuring 10 lakhs more. Let me take this opportunity to share across the information saying that we have already procured 10 lakhs doses of Covishield vaccine, and the vaccine is under the custody of KMSCL. I should say the price for each and every dose, whatever you are going to procure from KMSCL, shall be the price what the original manufacturer will be selling to you. In nutshell, each and every dose will be costing 600 rupees plus GST 5%, that is 630, which is the original cost of the manufacturer. There will not be any limitation, rather there will not be any hurdle for any private hospital to procure directly from KMSCL. We will not be setting a target saying that you should minimum order 100 doses, 1,000 doses, 10,000 doses. There will not be any hurdles like that. You can straight away order for 1 dose to 1 lakh. There is no hurdles for procurement through KMSCL by creating some limiting factors. Only one issue is that you have to pay online. You will be getting the vaccine after confirmation of the online payment from the district drug warehouses wherever the institutions are being situated. For example, suppose we are having one friend doctor in this group from Wayanad. They will be able to get the vaccine from district drug warehouse of Wayanad at Manandawadi once they are remitting the payment in the core group account, whatever is being maintained by KMSCL. I will share across one letter which will be detailing the account number as well as process flow to Dr. Srijitan Kumar, one of my brother. So, I mean, he will be communicating the same among our co-workers and senior leaders, so that you can best explore the opportunity for getting the vaccines to your beneficiaries through your private facilities. And once the liquidation of the already procured 10 lakhs doses are over, definitely we will be, hand holding further, so that the accelerated vaccine campaign, which is one of the steps for limiting the COVID infections among our neighbors, relatives, co-workers, we will take it up this initiative to the max, so that the limiting the infection, which is one of the novel strategies for controlling the COVID, will be achieved by the state of Kerala. Let me once again thank you, all the coordinators of this marvelous event, from my heart. And I'll be always there to coordinate with IMA as well as our senior leaders for the betterment of public and the poorest of the poor. Thank you. Once again, thank you for the member. Thank you for my member, Dr. Ilangovan sir, who has led me to the light of this opportunity by sitting in KMSCL and doing one of the novel professions. Thank you, sir.
Thank you very much, Dr. Dilip. In fact, you have made it so simple. So in fact, it was a long cherished dream for all of us, and all our small and medium institutions were really concerned about the vaccine procurement. So right now we have Dr. Dilip, the general manager of KMSCL, telling that we can order directly. And of course, Webs will share, Dr. Siriak Thomas will share with you the address and the account number, and you can directly liaise with KMSCL. So there is no middlemen involved, and you can directly procure the vaccine at the Serum Institute's rate itself. So thank you very much. Now we have the message from our health minister, Srimati Veena George. Our honorable health minister had been very, very helpful and cooperative, and she was a tremendous source of energy and support for all of us. And she was the person who actually started the second phase of iSafe, and which we were able to actively carry forward. We have briefed her on all the current happenings in iSafe, and we feel extremely happy in receiving the message of Honorable Health Minister Srimati Veena George. Over to Minister's office. There's an audio problem, I think. We can't hear. Can you increase the volume? We can't hear actually. I think maybe we'll come back to that, because there is some audio issue. So they just conveyed that they will do it again. So we'll just give 5 minutes for that, and thereafter we'll come back. So now we have two very important guests also with us. One is Dr. Sandeep and Dr. Mahesh, who are the inventors of Covino. I know that I am keeping Mr. Prem waiting because I want you to speak after the minister. So that's why I've kept you waiting. And it is with the kind support of the Malayali community of Singapore that the whole event today could happen. And, we do want to make certain announcements to you before you respond. So that's why we are keeping you waiting for a little while, but we'll soon get back to you within 5 minutes or so. So now let me request, we'll have a demo of the Covino mask. So the Covino mask is actually something very great. It's brilliant. We know that probably we are going to use masks for some time now, and we are all fed up with the cost and the logistics regarding the masks which we had all been using, which is actually disposable. And even though we sterilize and reuse, there is a life for that. But now two of our colleagues who are doctors, one is a cardiac surgeon and another is a pediatric surgeon from AIIMS, Amrita Institute, have come up with a very innovative idea. And I think we have to salute and appreciate their perseverance and their passion. They had been working for the last many months to make this materialize, but eventually they are hitting the market. In fact, I got a Covino mask a few months back, and I had been using that. And thanks to the personal affection of Sandeep, who is from an alumnus of the Calicut Medical College. Now we are joined by Dr. Sandeep and also his colleague, Dr. Mahesh, who would actually be introducing the Covino mask to us. So can I request Dr. Mahesh to kindly, it's a wonderful mask. Let's see that. And they have also assured that they're going to give a very special price. It is primarily targeted for doctors and health workers. That's their primary target. And thereafter, probably they would like to go public. So let me now request Dr. Mahesh to kindly share your presentation and give a brief address. Over to you, Dr. Mahesh.
Thank you so much, Dr. Srijit, for your comments, and thank you so much for having us here. And the PEPS team and IMA, we are really grateful, both me and my colleague, Dr. Sandeep, for this opportunity. And you've already given us several compliments. I hope that we will actually make it good. So. I'm a pediatric cardiologist at Amrita, and my colleague, Dr. Sandeep, is a plastic surgeon, and we are very proud to be here to be presenting Covino. So as this pandemic started, we were struggling with the issues with the mask, like you said. The major problem with the mask being the poor seal that is between the face and the mask, be it a surgical mask or be it the N95 mask. You always have some leak around the mask, which predisposes you to risks in any high risk environment. And this is a fact with almost every kind of mask that you wear. The other problem is that we are all forced to reuse these masks because they're not, like Dr. Srijit said, these masks don't last forever. So even if it's an N95 mask, most people can't really keep changing the masks every day. So this has become a major problem. And many of us are reusing these masks. Some people by just washing it, some people by just reusing it day after day, which is both unhygienic and unsafe. And thirdly, of course, we know that the masks are really hiding our personalities by really hiding our face and our expressions. And as doctors, this is a major challenge when we are communicating with our patients, isn't it? So these are all challenges that we were facing right from the beginning of the pandemic, and we were struggling to find solutions for this. And as healthcare innovators, despite being doctors, both me and Dr. Sandeep were involved in healthcare innovations, and we were trying to design something that would be safer for us and more convenient for us to use as physicians and people at high risk. So we were using CAD design and 3D printing technology. We played around with several designs and concepts to finally come up with what we felt is something that really is effective, safe, personal, and reusable. So this is the Covino. So short video to show how this mask really works. So this mask is made up of medical grade polycarbonate, and it has a replaceable filter. This filter is super safe. It is like 99% particle filtration efficiency and is capable of keeping out the coronavirus and many other pathogens. And it also has this very custom designed silicone margin, which will fit around and seal around the face. And it's so easy to assemble. You just put on these clips and then you're ready to put this mask on, and it provides you the perfect kind of seal around the face so that there is no air leak from around. There's no way that the virus can get in, and all the air that you breathe has to come in through the super safe filter. And this is a filter that you can change as many times as you want because the cost of the filter is very little and maybe about 2 rupees a piece for the filter piece. And when you buy this mask, a pack of 30 filters comes along with this. So this mask is meant to be safe because it is safe by design. It was designed to fit around the face in such a manner that there would be no air leak. And the filter is super safe and tested in the standard laboratories for over 99% particle filtration efficiency. And this is a sustainable device because you can reuse it. This may be your only mask that you use during the entire pandemic because you could just wash it with soap and water or clean it with an alcohol swab and you're ready to go again. All that you need to do is change that filter once. And this also is a very personal device because the others, especially your patients, can actually see your facial expressions. They can see your smile. It makes communication so much more easier. And we in our own hospital, we have been using this mask, and this mask has kept us protected from COVID, even in the most risky of situations. And we've really tested it in the clinical environment. And we feel that it can be very, very protective for people, particularly those at high risk, like doctors, physicians, nurses, and other people at high risk, people who are in air travel, people who are taking care of patients with COVID. So this is the product that we wanted to show to you today. And we brought it out in 2 versions. One is called the regular version, the one that I'm wearing. If you can see my video, this is the regular version. All I do is I just pull this on and pull the strap, and I'm ready to go. And the other is this called the Pro version. The only difference is the design of the silicone margin. This gives a more safer, more protective seal, and both of these masks can be really, really protective for all people in the high risk environment. So the intention is that let's all try to build a safer world together, and let's all be vaccinated and masked and keep ourselves, our colleagues, and our families safe. Thank you so much for this opportunity to highlight the features of this mask in this forum, and we're very, very happy to be here. Thank you so much, Akshit, the PEPS team, and IMA for the opportunity.
Thank you very much, Dr. Mahesh. Let me request Sandeep also to say 2 lines, and also I'll coax you to announce that special rate for IMA doctors also.
Yeah, sure. Thanks a lot, Dr. Srijit and other IMA office bearers, and for giving this particular opportunity to us, because we are 2 young novices who have never ever gone into business models. We were actually finding it very difficult to go on with this particular innovative product. But because of a lot of encouragement from people like Dr. Srijit, we have actually been able to come out with the actual product. See, this particular product, what we have actually manufactured, we have got 2 models, like Dr. Mahesh said. There's a regular model and then there is the Pro version. The regular model, the MRP is 1,250, and for the Pro version, the MRP is 1,450. So what we have offered for the IMA for the next 15 days till September 15th is that all the members of the IMA, they can actually get this directly, because IMA PEPS is actually giving a discount for them, and you can actually get it at a 400 rupees discount for the regular version and a 500 rupees discount for the professional version, Pro version. So the cost would come to 850 and 950 rupees, and it would come with 30 days filters also, 30 filters also along with that. And any number of filters also could be procured at, I think, around 60 rupees for a pack of 30 filters. That is 2 rupees per day, kind of a thing. So I hope all of you would come forward and use this mask and be safe. The most important thing is not the cost. The most important thing is, I think, you have got one of the safest masks that is possible in this current scenario. Thank you very much, Dr. Srijit, once again for giving this opportunity. Thank you, IMA PEPS, and all the IMA members for giving this opportunity. Let us hope that we are able to extend this to all the IMA members, and as well as for the other healthcare and other frontline workers, and of course the people who are really needing this mask also. Thank you very much, and have a safe day.
Very much. Yeah, thanks a lot, Dr. Sandeep. In fact, personally, I'd been thanks to you. You had sent both those versions. I'd been using that. They're very, very comfortable, and I'm sure that our colleagues after using will have few more tips and suggestions to offer. But above all, we are so proud that two doctors, that to the highest level of professionals, are committed to making a change, and that is exactly what we want. In fact, PEPS would like to encourage all our colleagues and doctors to come forward, think, innovate, because many a times, the industry otherwise take us for granted. And in fact, we would be very, very happy to bring up with, startups, and let's help each other. So congratulations, we feel so very proud. I'm not standing any authority for the quality, because it is for everyone to judge. But one thing I'll tell you, we are very, very proud of you, because when we had all been tracking the regular way, you had been going out of the track and, doing something very, very innovative, and we feel very proud of both of you. So congratulations, Dr. Mahesh and Dr. Sandeep. And, for anyone who would like to order, you can place your order to PEPS 8078478278. You can send an requirement. We will give it to them, and they will send courier that directly to you. So PEPS is not involved in any other way. We'll just collect your number. We'll hand it over to their marketing team, and they will get it to you. And of course, all the middlemen are excluded, so that you get the rates what Dr. Sandeep just now announced. So thank you very much, Dr. Sandeep and Mahesh, for joining us and giving this very kind offer also. And I'm sure that you'll be encouraged by the response, and you will probably extend it beyond 15th also. Let's hope so. So thank you very much. Now, so is the minister's message ready? Can we have that? Now, again, there is some audio issue.
Dr. Srijit, this is Prem. Can you hear me?
Yes.
Yeah, but probably when in Zoom, if you are playing a recorded video, when you do a share screen, there are two checkboxes at the bottom. One of the checkbox says use computer audio. Those two checkboxes has to be selected when you play a video. That's why probably the audio is not coming.
So Stanley, can you do that?
Yeah, you need to you need to share screen one more time. Stop sharing and share screen one more time.
Stop sharing.
And when you click share on the pop-up, there is at the bottom, you can see there are two check boxes. One says audio from your computer or something like that, and the other one says optimize the video. So it'd be good to check those two boxes.
Where does it come, sir?
At the bottom. Now, when you click on the share screen, there will be a pop-up screen, right? Screen at the bottom, all the way down. You see desktop and all those things all the way down on the pop-up panel. You see a share sound. Sorry, now it has changed. The share sound and optimize video clip. Do you see that? Before you click share. Yeah.
Okay, I think what we can do is, Stanley, you can just play it. Audio clip.
Principal Secretary Bahumananaya Dr. Ilangovan IAS, IMA Bahumananaya Sana Bharavahigal, Bahumanapata Jilla Bharavahigal, doctors, Priyapata Sahodri Sahodanbari. COVID-19 പ്രതിരോധ പ്രവർത്തനങ്ങൾ ഊർജിതമായി നമ്മൾ മുന്നോട്ട് കൊണ്ടുപോകുന്ന കാലഘട്ടമാണ് ഇത്. കേരളത്തെ സംബന്ധിച്ചിടത്തോളം ഈ രണ്ടാം തരംഗം ഡെൽറ്റ വേരിയന്റിലൂടെയാണ് ഏറ്റവും അധികം രോഗവ്യാപനം ഈ രണ്ടാം തരംഗത്തിൽ ഉണ്ടായിരിക്കുന്നത് എന്നുള്ളത് ജനിതക ശ്രേണീകരണത്തിലൂടെ വ്യക്തമായിട്ടുള്ളതാണ്. നമ്മുടെ മുന്നിലുള്ള ഏറ്റവും പ്രധാനപ്പെട്ട ലക്ഷ്യം നമ്മുടെ എല്ലാ ആളുകൾക്കും 18 വയസ്സിന് മുകളിലുള്ളവർക്ക് സെപ്റ്റംബർ മാസം 30-നകം എല്ലാവർക്കും വാക്സിൻ നൽകുക എന്നുള്ളതാണ്. സെപ്റ്റംബർ മാസം 30-നകം എല്ലാവർക്കും ഫസ്റ്റ് ഡോസ് വാക്സിൻ നൽകാൻ കഴിയുകയും അതോടൊപ്പം തന്നെ ഈ സെപ്റ്റംബറിൽ ഡ്യൂ ആകുന്ന സെക്കൻഡ് ഡോസ് നൽകാൻ കഴിയുകയും അതിനുശേഷം അതിനനുസരിച്ച് സെക്കൻഡ് ഡോസ് അർഹമായിട്ടുള്ളവർക്ക് സമയബന്ധിതമായി നൽകാൻ കഴിയുകയും ചെയ്യുക എന്നുള്ളതാണ് നമ്മൾ ലക്ഷ്യമിടുന്നത്. അത് വാക്സിൻ്റെ അവൈലബിലിറ്റി ആശ്രയിച്ചാണ് ഇരിക്കുന്നത്. എന്നിരുന്നാൽ പോലും കേന്ദ്രത്തിൽ നിന്നുള്ള നമുക്ക് ലഭിച്ച മറുപടി അനുസരിച്ച് നല്ല രീതിയിൽ വാക്സിൻ സെപ്റ്റംബർ മാസത്തിൽ നമുക്ക് ലഭിക്കുവാൻ സാധ്യതയുണ്ട്. ഈ കോവിഡ് നിയന്ത്രണത്തിൽ ഇന്ത്യൻ മെഡിക്കൽ അസോസിയേഷൻ വളരെ മികച്ച രീതിയിലുള്ള ഇടപെടലുകളും ബോധവൽക്കരണവും മറ്റ് പ്രവർത്തനങ്ങളും നടത്തിയിട്ടുണ്ട് എന്ന് ഈ അവസരത്തിൽ എടുത്തു പറയാനായിട്ട് ആഗ്രഹിക്കുകയാണ്. IMA പല പരിപാടികളിലും ഈ കുറഞ്ഞ സമയത്തിനുള്ളിൽ 3 മാസ കാലയളവിനുള്ളിൽ പല പരിപാടികളിലും പങ്കെടുക്കുന്നതിന് എനിക്ക് സാധിച്ചു. അതിലേക്കൊക്കെ എന്നെ ക്ഷണിച്ചതിൽ, ഈ മീറ്റിങ്ങിലേക്കും ക്ഷണിച്ചതിൽ ഞാൻ നന്ദി അറിയിക്കുന്നു. IMA ഐ സേഫ് കോവിഡ് കോംബാറ്റിൻ്റെ ക്യാമ്പയിനിൻ്റെ ഉദ്ഘാടനമാണ് ഇന്ന് ഇവിടെ നടത്തപ്പെടുന്നത്. ആരോഗ്യ പ്രവർത്തകർക്ക്, പ്രത്യേകിച്ച് ഗവൺമെൻറ് സെക്ടറിലും പ്രൈവറ്റ് സെക്ടറിലുമുള്ള ഡോക്ടേഴ്സ് ഉൾപ്പെടെയുള്ളവർക്ക് സേഫ്റ്റി എക്യൂപ്മെൻറ്റ് ഡിസ്ട്രിബ്യൂഷൻ ക്യാമ്പയിനാണ് ഇന്ന് ഇവിടെ ലോഞ്ച് ചെയ്യപ്പെടുന്നത്. ഇതിൽ മാസ്കും അതുപോലെ തന്നെ ഗ്ലൗസും സാനിറ്റൈസേഴ്സും ഒക്കെ നൽകുന്നതിന് വേണ്ടിയിട്ടുള്ള പരിശ്രമമാണ് IMA നൽകുന്നത്. നമുക്കറിയാം, സ്വയം പ്രതിരോധമാണ് ഏറ്റവും വലിയ പ്രതിരോധം. കാരണം ജീവൻ രക്ഷിക്കണം, ജീവനോപാധിയും സംരക്ഷിക്കണം. ഈ 2 കാര്യങ്ങളും ഏറ്റെടുത്തുകൊണ്ടാണ് സംസ്ഥാന സർക്കാർ മുന്നോട്ട് പോകുന്നത്. അപ്പോൾ ഇങ്ങനെയൊരു കാലഘട്ടത്തിൽ നമ്മുടെ ഒരു പോസ്റ്റ് വാക്സിൻ ഇറയിലേക്ക് നമ്മൾ എത്തപ്പെട്ടിരിക്കുന്ന ഒരു സാഹചര്യം, അല്ലെങ്കിൽ എത്തപ്പെടുന്ന ഒരു സാഹചര്യമാണ്. വാക്സിനേഷൻ പൂർത്തീകരിച്ച് കഴിഞ്ഞിട്ടാണ് അത് പൂർണ്ണമായിട്ട് പോസ്റ്റ് വാക്സിൻ ഇറ എന്നുള്ളത് നമുക്ക് പറയാൻ കഴിയും. ഇപ്പോൾ വാക്സിനേഷൻ പ്രോസസ്സ് നടന്നുകൊണ്ടിരിക്കുകയാണ്. അപ്പോൾ ഇങ്ങനെയുള്ള ഒരു കാലഘട്ടത്തിൽ പ്രത്യേകിച്ച് നമ്മുടെ സ്വയം പ്രതിരോധത്തിൽ എല്ലാവരും കൂടുതൽ ശ്രദ്ധ കൊടുക്കേണ്ട ഒരു കാലഘട്ടമാണ്. അതുകൊണ്ട് തന്നെ നിശ്ചയമായിട്ടും ഇന്നിവിടെ ലോഞ്ച് ചെയ്യപ്പെടുന്ന ഈ പരിപാടിയിലൂടെ വിതരണം ചെയ്യപ്പെടുന്ന മാസ്ക്, ഗ്ലൗസ്, സാനിറ്റൈസർ തുടങ്ങിയ സുരക്ഷാ ഉപകരണങ്ങൾ എല്ലാവർക്കും പ്രയോജനപ്പെടും എന്ന് ഞാൻ പ്രത്യേകമായി പ്രതീക്ഷിക്കുകയാണ്. അതുപോലെ തന്നെ ഈ സിംഗപ്പൂർ മലയാളി അസോസിയേഷൻ്റെ സഹായത്തോടെയാണ് ഈ സുരക്ഷാ ഉപകരണങ്ങളുടെ വിതരണം IMA നിർവഹിക്കുന്നത്. അവരോട് പ്രത്യേകമായ നന്ദി അറിയിക്കുന്നു. ഐസേഫ് പദ്ധതിയുടെ ഈ ലോഞ്ച് എല്ലാവരുടെയും അനുവാദത്തോടെ ഈ സുരക്ഷാ ഉപകരണങ്ങളുടെ വിതരണത്തിൻ്റെ ലോഞ്ച് നിർവഹിക്കുന്നതായി അറിയിക്കുന്നു. പ്രത്യേകിച്ച് ഈ മീറ്റിങ്ങിൽ സംസാരിക്കുന്ന ബഹുമാന്യനായ ഡോക്ടർ ഇലങ്കോവൻ IAS അദ്ദേഹത്തിൻ്റെ പുതിയ പുസ്തകം ക്രിയേറ്റിംഗ് വാല്യൂസ് ഇൻ ഹെൽത്ത് കെയർ എന്നുള്ളത് സംബന്ധിച്ച്, ആരോഗ്യ മേഖലയെ സംബന്ധിച്ചിടത്തോളം വളരെ വലിയ ഒരു സംഭാവനയാണ് അദ്ദേഹത്തിൻ്റെ ഭാഗത്തു നിന്നുണ്ടായിരിക്കുന്നത്. നമ്മുടെ കാഴ്ചകളെ, കാഴ്ചപ്പാടുകളെ ഒക്കെ തന്നെ വിശാലമാക്കുന്ന, കുറച്ചുകൂടി ശക്തമാക്കുന്ന ആശയങ്ങളും അതുപോലെ തന്നെ ചിന്തകളുമാണ് അദ്ദേഹം പങ്കുവച്ചിരിക്കുന്നത്. അദ്ദേഹവും ഈ മീറ്റിങ്ങിൽ പങ്കെടുക്കുന്നു എന്നുള്ളത് വളരെ സന്തോഷമുള്ള കാര്യമാണ്. അദ്ദേഹത്തിൻ്റെ ഈ പുസ്തകത്തിന് പരമാവധി പ്രചാരം നൽകുവാൻ IMAയും ഏറ്റെടുത്തിരിക്കുന്ന ഈ ഉത്തരവാദിത്തത്തെ പ്രത്യേക.
So thank you very much. So thank you very much. In fact, Minister was called urgently by the Chief Minister for a urgent evaluation meeting. And adondana Madam last minute she had sent us a message. Otherwise, she was very keen to participate. Adalla ividuthe ella karyangalum njangal neritta minister brief cheyirunnu, and she was very, very happy and proud of the happenings here. And before I invite Prem sir, let me just tell you that നമ്മുടെ ഒരുപാട് മാസ്ക്സും അതുപോലെ സാനിറ്റൈസേഴ്സും ഗ്ലൗസും മറ്റ് സുരക്ഷാ ഉപകരണങ്ങളും സിംഗപ്പൂരിലെ മലയാളി കമ്മ്യൂണിറ്റിയുടെ സഹായത്തോടെ ഈ ഐസേഫിന്റെ ഈ ഒരു ഘട്ടത്തിലേക്കായി വിന്യസിക്കുകയാണ്. അതിൽ സർക്കാർ സ്ഥാപനങ്ങളിലേക്ക് നമുക്ക് കേരളത്തിലെ ഏതാണ്ട് 40ഓളം IMA ബ്രാഞ്ചുകളിൽ നിന്ന് ഏതാണ്ട് 96 സർക്കാർ സ്ഥാപനങ്ങളിലേക്കുള്ള ലിസ്റ്റ് നമ്മൾ സമാഹരിച്ചിട്ടുണ്ട്. അവർക്കെല്ലാം കഴിയുന്നിടത്തോളം മാസ്കുകൾ നമ്മൾ വിതരണം ചെയ്യും. അതുകൂടാതെ ഐസേഫിന്റെ ഏതാണ്ട് 1000ഓളം അംഗങ്ങൾക്ക് നമ്മൾ ഇത് വിതരണം ചെയ്യും. അതുകൂടാതെ ആംബുലൻസ് ഓണേഴ്സ് ആൻഡ് ഡ്രൈവേഴ്സ് അസോസിയേഷന്റെ നേതാക്കളായ ശ്രീ ഡെന്നിസ്, ശ്രീ അനു, ശ്രീ ഷാജുദ്ദീൻ, അതുപോലെ കേരള ആംബുലൻസ് ഡ്രൈവേഴ്സ് ആൻഡ് ടെക്നീഷ്യൻസ് അസോസിയേഷൻ KDTയുടെ നേതാക്കളായ അഭിലാഷ്, ശ്രീ ജലീൽ, അവരെല്ലാവരും ഈ മീറ്റിംഗിൽ ഇപ്പോൾ പങ്കെടുത്തുകൊണ്ടിരിക്കുകയാണ്. നമ്മുടെ ട്രോമ റെസ്ക്യൂ ഇനിഷ്യേറ്റീവ് ഇന്ത്യൻ മെഡിക്കൽ അസോസിയേഷന്റെ ഒരു വലിയ സംരംഭമാണ്. അപ്പോൾ ഈ ട്രോമ റെസ്ക്യൂ ഇനിഷ്യേറ്റീവിന്റെ ഭാഗമായി നമ്മുടെ ആംബുലൻസിന്റെ ഞങ്ങൾ അവരെ റെസ്ക്യൂ ക്യാപ്റ്റൻസ് എന്നാണ് വിളിക്കുന്നത്. എല്ലാ ജില്ലകളിലുമുള്ള ആംബുലൻസ് ഓടിക്കുന്ന നമ്മുടെ റെസ്ക്യൂ ക്യാപ്റ്റൻസിന് വേണ്ട കഴിയുന്നിടത്തോളം സുരക്ഷാ ഉപകരണങ്ങൾ കൂടി ഇതിന്റെ ഭാഗമായി നൽകുവാൻ ശ്രമിക്കും. നമുക്ക് പരിമിതമായ റിസോഴ്സസ് ആണ് ഇപ്പോൾ ലഭ്യമായിരിക്കുന്നത്. പക്ഷെ എന്നാൽ കൂടുതൽ നമ്മൾ ഉടൻ ലഭ്യമാക്കാൻ ശ്രമിക്കുന്നുണ്ട്. ഏതായാലും കിട്ടിയ സാധനങ്ങൾ നമ്മൾ തുല്യമായി എല്ലാവരിലേക്കും എത്തിക്കുക എന്നുള്ളതാണ് നമ്മുടെ ദൗത്യം. ഇതിന് മുന്നോട്ട് വന്ന എനിക്കറിയാം ശ്രീ പ്രേമും അതുപോലെ ശ്രീ ശ്രീകാന്തിന്റെയും നേതൃത്വത്തിൽ, അതുപോലെ ഈ വഴികാട്ടിയായത് നമ്മുടെ പുനലൂർ ബ്രാഞ്ചിന്റെ പ്രസിഡന്റ് കൂടിയായ ഡോക്ടർ നാരായണൻ നായർ സാറാണ്. അദ്ദേഹമാണ് നമ്മളെ ഇൻട്രൊഡ്യൂസ് ചെയ്തത് തന്നെ. അപ്പം ഈ ഒരു വലിയ സംരംഭത്തിന് ഇന്ത്യൻ മെഡിക്കൽ അസോസിയേഷന്റെയും കേരളത്തിലെ മുഴുവൻ ഡോക്ടർമാരുടെയും ആരോഗ്യ പ്രവർത്തകരുടെയും ആംബുലൻസിന്റെ നമ്മുടെ റെസ്ക്യൂ ക്യാപ്റ്റന്മാരുടെയും അസോസിയേഷനുകളുടെയും പേരിൽ നന്ദി രേഖപ്പെടുത്തിക്കൊണ്ട് ബഹുമാനപൂർവ്വം സിംഗപ്പൂർ മലയാളി അസോസിയേഷന്റെ അധ്യക്ഷൻ ശ്രീ പ്രേമിനെ ഈ 2 വാക്ക് സംസാരിക്കുവാൻ ക്ഷണിക്കുന്നു.
വളരെ നന്ദി ഡോക്ടർ ശ്രീജിത്ത് എൻ കുമാർ. എനിക്ക് വാസ്തവത്തില് ഈ ഒരു ഡോക്ടേഴ്സ് പാനലിൽ വന്ന് നിങ്ങൾ ചെയ്യുന്ന കാര്യങ്ങളുടെ മുമ്പേ മലയാളി അസോസിയേഷനും ഇവിടെയുള്ള സിംഗപ്പൂരിലുള്ള മലയാളി ഓർഗനൈസേഷനും കൂടെ ചെയ്ത് താരതമ്യം ചെയ്യുമ്പോൾ ഞങ്ങൾ ചെയ്ത് വളരെ 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 ചെറിയൊരു എളിയ കാര്യമാണ്. Anyway, thank you very much for inviting us. Okay. Honorable Minister for Health, Mrs. Veena George, Dr. Elangovan, IAS, Dr. Dilip Kumar, Dr. T.P. Zacharias, Dr. Sujit Kumar, Dr. Siriak Thomas, distinguished guests. Ellavarkum ende vinithamaya namaskaram. First of all, I would like to salute the Kerala healthcare workers for the exemplary service they have been doing in the fight against COVID. Current Kerala COVID-19 statistics is concerning, but many experts like the top virologist, Professor Dr. Gagandeep Khan, and epidemiologist from Michigan University, Dr. Brahma Mukherjee, says the Kerala is doing the right thing. They are given all the statistics on all those things which they use to argue. They are using it to argue their point, but their argument is Kerala model is working. Dear doctors, you are in the forefront of this fight, and the credit goes to you. Thank you very much. At this time, I would also like to express my sincere gratitude to the Honorable Minister, Mrs. Veena George, for the guidance and leadership for the Kerala COVID fight. Singapore's Malayali organizations have come together for a common cause multiple times. In 2018, the Malayali Kutaima jointly raised 2.25 crores for Kerala flood relief. Last year, Kutaima supported over 400 Malayalis in Singapore who were affected by the COVID lockdown. We provided food, accommodation, medical repatriation, legal and counseling assistance to those who needed it. We again came together this time for helping Kerala's fight against COVID and raised a very small amount. While raising the fund, we explored various options for helping Kerala's flood relief. COVID fight. And soon we realized that there were multiple bottlenecks. One of the major factor was the cost of shipping, say, COVID essentials like masks, sanitizers. Initially, we are also looking at ventilators. The cost of shipping from Singapore or China was quite big. That would take a substantial portion of the money we raised. So this is when we heard about IMA's iSafe 2.0. I believe that was what it was called at that time, program. We discussed with IMA's Dr. Sujit Kumar and Dr. Siriak Thomas, and decided to go with this program. The process was quite transparent and very straightforward. And we had the confidence that the items we donated will reach the right people. We could use 100% of the money we raised for this cause. I would like to thank Dr. Sujit Kumar and Dr. Siriak Thomas from IMA and Mr. Srikanth from Singapore Malayali Association for coordinating this whole activity. We are grateful to IMA for giving Singapore Malayali community an opportunity to be a part of this movement. We will be happy to support future IMA initiatives in whatever way we can. I would also like to record my gratitude to the following organizations. You can see on the screen who for joining Singapore Malayali Association in this noble cause, namely College of Engineering, Trivandrum Alumni, Singapore Royal Cricket Club, Jurong Beach, Indian Cultural Association, Singapore Malayali Club, World Malayali Council, Singapore Malayali Hindu Samajam, NSS Palakkad Alumni, Singapore Malayalis in Singapore, and Kerala Art Lovers Association. It has been an honor to be among such accomplished individuals, and thank you very much for giving me an opportunity to talk. Thank you. Good evening.
Thank you very much, sir. In fact, we do cherish the association with you, and we look forward to much more pleasant interactions in future.
Thank you.
Now, with that, we come to the end of the official session. ഞാൻ AOD-യുടെയും KDT-യുടെയും ലീഡേഴ്സ് ഇവിടെ ഉണ്ട്. മീൻസ് ഒരു വരി പറയാൻ ആരെങ്കിലും സന്നദ്ധരാണെങ്കിൽ എനിക്കൊന്ന് മെസ്സേജ് അയക്കാമെങ്കിൽ ഞാൻ വിളിക്കാമായിരുന്നു. ആരാണ്? മിസ്റ്റർ ഡെന്നി ആണോ അതോ അനു ആണോ? ഉണ്ടെങ്കിൽ ഓക്കെ. അതുപോലെ KDT-യിൽ ജലീൽ ഉണ്ടോ? ജലീൽ രണ്ടുപേര് പറയൂ. ജലീൽ
സർ, ഇന്ത്യൻ മെഡിക്കൽ അസോസിയേഷൻ നടത്തുന്ന എല്ലാ പ്രവർത്തനങ്ങളിലും പങ്കാളികളായിട്ടുള്ള ഒരു അസോസിയേഷനാണ് കേരള ആംബുലൻസ് ഡ്രൈവേഴ്സ് ആൻഡ് ടെക്നീഷ്യൻ അസോസിയേഷൻ. വരും കാലങ്ങളിലും എന്ത് പ്രവർത്തനം നടത്തിയാലും അതിനൊക്കെ പൂർണ്ണ പിന്തുണയും എല്ലാ സഹായ സഹകരണങ്ങളും ഞങ്ങൾ അറിയിക്കുകയാണ്. തിരിച്ചും ഞങ്ങൾക്ക് വേണ്ട എല്ലാ സഹായങ്ങളും ചെയ്തു തരണമെന്ന് അഭ്യർത്ഥിക്കുകയാണ്. ഈ സൂം മീറ്റിംഗിൽ പങ്കെടുത്ത എല്ലാവർക്കും ഹൃദയത്തിൽ നിന്ന് നന്ദി അറിയിക്കുന്നു.
താങ്ക് യു. ഓക്കെ, ഞാൻ മിസ്റ്റർ ഡെന്നി. കുറച്ചൊന്ന് ഉറക്കെ പറയാമെങ്കിൽ.
ഇതുവരെ IMA നടത്തിയ എല്ലാ കാര്യങ്ങളിലും നമ്മളും അതിന്റെ ഭാഗമായിട്ട് കൂടെ നിന്നിട്ടുണ്ട്. എല്ലാ ഗവൺമെന്റ് നടത്തുന്നതുമായ എല്ലാ നല്ല നല്ല പ്രവർത്തനങ്ങളും കോവിഡ് പ്രതിരോധ പ്രവർത്തനങ്ങളിലായിക്കോട്ടെ, എന്ത് കാര്യങ്ങളിലായിക്കോട്ടെ, നല്ല നല്ല കാര്യങ്ങളുമായിട്ട് ഞങ്ങൾ സഹകരിച്ചു പോകുന്നു. നോർക്ക റൂട്ട്സ് അങ്ങനെയുള്ള എല്ലാ കാര്യങ്ങളുമായിട്ട് നമ്മൾ സഹകരിച്ചാവുന്നു പോകുന്നു. ഇന്ന് ഈ പ്രോഗ്രാം ഉദ്ഘാടനം ചെയ്ത നമ്മുടെ ബഹുമാന്യ വീണ ജോർജ് മേഡം, ഹെൽത്ത് മിനിസ്റ്റർ, ഇളങ്കോവൻ സാർ IAS, ശ്രീ സാറ്, അതുപോലെ തന്നെ പ്രേം സാർ, സിംഗപ്പൂർ മലയാളി അസോസിയേഷന്റെ പ്രേം സാറ്, അതുപോലെ തന്നെ നമ്മുടെ IMA-യുടെ പ്രസിഡന്റ് സക്കറിയ സാറ്, ഇവരൊക്കെ എല്ലാവരുമായിട്ട് നല്ല ബന്ധത്തിൽ പോകണമെന്നുള്ള ഒരു ഉദ്ദേശത്തോടു കൂടിയാണ് നമ്മൾ പോകുന്നത്. എന്തായാലും നല്ല നല്ല പ്രവർത്തനങ്ങൾ സിംഗപ്പൂർ മലയാളി അസോസിയേഷൻ നടത്തുന്ന ഈ നല്ല ഒരു കോവിഡ് പ്രതിരോധ പ്രവർത്തനത്തിന്റെ സുരക്ഷാ ഉപകരണങ്ങളുടെ വിതരണവും ഇതുമായിട്ട് ബന്ധപ്പെട്ട് എല്ലാ കാര്യങ്ങളുമായിട്ട് നമ്മൾ സഹകരിച്ച് നീങ്ങുന്നതാണ്. അവർക്ക് ഇനിയും ഇതുപോലെയുള്ള നല്ല നല്ല പ്രവർത്തനങ്ങൾ നൽകാൻ ദൈവം സർവേശ്വരൻ ഇത് നൽകട്ടെ എന്ന് പ്രാർത്ഥിക്കുന്നു. നന്ദി, നമസ്കാരം.
താങ്ക് യു വെരി മച്ച്. നമ്മുടെ ഈ ട്രോമ റെസ്ക്യൂ ഇനിഷ്യേറ്റീവില് ഞാനും ഉണ്ടെങ്കിലും പ്രധാനമായി ഇതിന്റെ കാര്യങ്ങളൊക്കെ ക്രോഡീകരിച്ചുകൊണ്ടിരിക്കുന്ന നമ്മുടെ ജോൺ പണിക്കർ സാറാണ്. ജോൺ പണിക്കർ സാറോട് ഒരു രണ്ട് വരി പറയാൻ. സാർ ഒരുപാട് നാളായിട്ട് പറയുന്നുണ്ട് നമ്മുടെ റെസ്ക്യൂ ക്യാപ്റ്റൻസിനൊക്കെ ഇതിപ്പോ കുറച്ച് സാനിറ്റൈസേഴ്സ് ഇതൊക്കെ കൊടുക്കണം എന്നുള്ളത്. ഇപ്പോഴാണ് അത് സാധ്യമായത്. പണിക്കർ സാർ രണ്ട് വരി. വീഡിയോയും കൂടെ ഓൺ ചെയ്യണം. ഓക്കെ, പറയണം സാർ.
So I will just turn to the right. So actually I want to congratulate the whole team of ISAF. Adana outside, I want to congratulate all of you. Actually, this is a great boon to the ordinary doctors who are working in the periphery and in small hospital like me. Actually, I am representing the doctors community, the common practicing doctors community, and it's a great boon for all of us. Adime, I want to tell you. And another thing is, I want to thank the diaspora of Malayali diaspora in many countries, especially Singapore, for taking this support. Actually, Dr. Narayan Nair is my own classmate, and I am happy that he is instrumental in arranging all these programs. So I want to thank and congratulate Dr. Narayan Nair also. And regarding the ഇപ്പോഴത്തെ ഈ ആംബുലൻസിന്റെ ഈ പറഞ്ഞ അത് ശരിക്കും പറഞ്ഞാൽ ഈ രണ്ട് അസോസിയേഷൻസും നമുക്ക് കഴിഞ്ഞ ഒരു 3-4 years ആയിട്ട്, even for the COVID, irrespective of the payment they are getting, they were supporting the patient transport of the COVID patients. അത് കുറെ നാളായിട്ട് പല ജില്ലകളിലും. ഇപ്പൊ പിന്നെ 108 വന്നപ്പം കുറച്ച് അവർ കുറഞ്ഞെങ്കിൽ തന്നെ especially in the initial stage when lot of cases were there, the 108 മാത്രം അത് ചെയ്യാൻ പറ്റാത്ത ഒരു സ്റ്റേജിൽ അവർ ഭയങ്കര സപ്പോർട്ടാണ് ചെയ്തത്. അവർക്കും ഈ പറഞ്ഞ പോലെ നമ്മളൊരു സപ്പോർട്ട് കൊടുക്കുന്നത് എത്രയും നല്ല ഒരു ഉചിതമാണെന്ന് പറഞ്ഞുകൊണ്ടും നിങ്ങൾക്ക് എല്ലാവർക്കും ഒരിക്കൽ കൂടെ നന്ദി പറഞ്ഞിട്ടുണ്ടായിരുന്നു. താങ്ക് യു വെരി മച്ച്.
So thank you very much, sir. So now I'm extremely sorry to both Dr. Sajith Kumar and Dr. Altaf, our distinguished faculty members. അവർ രണ്ടുപേരും വളരെ വിശദമായിട്ട് കോവിഡിന്റെ ക്ലിനിക്കൽ ആസ്പെക്ട്സിനെ കുറിച്ചും അതുപോലെ കോവിഡ് പ്രിവെന്റീവ് മെഷേഴ്സിനെ കുറിച്ചും മുമ്പ് നമ്മളോട് സംസാരിച്ചിരുന്നു. Now there is little change of information. So what we had asked them was to kindly enlighten us on what are the new changes which has happened, and what is the current control strategies, and what are the current guidelines in COVID management. Of course, both of them had given some very elaborate lectures in the past. So today they will be speaking to us 10 minutes each on the current changes in government guidelines and also the current changes in management strategies. So first, let me request Dr. Sajith Kumar. He is the Chief Nodal Officer for COVID control for the National Union Government. He's a very distinguished teacher, a very senior professor, very respectable figure in the field of medicine, and he's professor in medicine at Medical College Calicut, Medical College Kottayam. So over to you, Sajith Kumar sir, and I'm extremely sorry for keeping you waiting. And now we are all ears to hear you about the current strategies in COVID management. Over to you, Sajith Kumar sir. Sajith sir, you are a co-host, sir. You can speak now. Sajith sir, you have been made co-host. You can unmute and speak now, sir. Okay, if Sajith sir is currently unavailable, maybe we'll start with Dr. Altaf and come back to Sajith sir. So Dr. Altaf, can you, yeah.
Yes. Okay.
Again, Dr. Altaf is a very important leader of Indian Medical Association. He had been pivotal in giving us guidance in a lot of COVID control activities. And Altaf would today mention just the changes on the current guidelines, especially the government guidelines. Most of us are confused with that. So in 10 minutes or so, Altaf would quickly take us through the changes in the current guidelines. Over to you, Dr. Altaf.
Okay, thank you, Dr. Srijit, for inviting me for this program. And as you mentioned, we have discussed many things in the past. Right now, I will take hardly 10 minutes only, very few slides, and I have to mention about the recent changes in the guidelines and the most important changes in the findings on the epidemiological findings, regional as well as the global changes also. Thank you once again, Dr. Srijit, for inviting me for this program, and respected IMA state leaders and all of the dignitaries, all my dear friends. So, first of all, actually, we are well aware about this thing, about Kerala. In the past, across the globe, all of them discussed about the Kerala model of controlling the COVID strategies. And right now, most of the prices, actually they are discussing about the current situation, why the number of cases is increasing. And only hardly 2.5% of the population in India is having 60% of the case load right now. This is the current situation. And across the globe, almost 22 crores of cases we are crossed, and deaths almost 45 lakhs. And you can see the graph right below. And there are several waves across the globe, actually, not only one or two waves, actually there were several waves. One in the first quarter, that is March, April, May of the 2020. Next, the September, October, November, December period, the second, then third wave, and right now, almost the fourth wave is ongoing across the globe, actually. And in India, actually, we were facing the second wave, and this is the last leg we are expecting so. And across the globe, one or two changes across globe in United States, although they gave almost 53% of the population given 2 doses of vaccines, even though they are facing a crisis right now, mostly due to the unvaccinated people. And in Taiwan, that is another scenario. All these years, actually, for the last 18 months, they fought with COVID, and actually they effectively prevented this thing. And for the last 2 or 3 months, reporting significant number, almost 16,000 cases reporting, and almost 837 deaths so far. And the vaccination process is very slow there. And in Israel also, we know almost 60% got fully vaccinated, even though they are facing another wave right now. And these are the situations across the globe. And also we have to look into the recent about the recent variants of concern. Recently, 1 or 2 variants of concern reported, variants of importance reported. Anyway, the transmissibility of the variants is one concern. The disease severity is another concern, and risk of reinfection and impacts on diagnostics and vaccine performance. These are the concern regarding new variants. And right now, the Delta variant is ongoing, is going through the Southeast Asian region. And one new variant detected in Colombia, South America, first detected in January, and they recognized, designated it on 30th August, means 2-3 days back only. That is called new variant. It is having significant immune escape character also. That may become a variant of concern in the near future. That is another concern, actually. And one more thing, I think most of you listened that thing, C12 variant in South Africa. That is also having immune escape property character, and that is also that may also become a variant of concern in the near future. The more transmission continues, the more likely that new, more nefarious variants may evolve. That is the concerns left. And the next wave, actually, we have to face the next wave through different mutated variants, reducing transmission to reduce occurrence of mutations. That is the most important challenge we have to face. Early identification of mutant strains that can cause the next wave, and universal vaccination. That is the current strategy of Kerala, and at the national level also, we are doing this thing. Universal vaccination is our strategy, and development of curative drugs that is actually ongoing across the globe in various countries. Sustained preparedness is the most important thing. We have to just the thing we have faced in the second wave, the oxygen scarcity in many states, that is another concern. And the current scenario across globe, national level, and Kerala. And Kerala, right now we have 40 lakhs cases reported and 22,000 deaths almost. And 2 crores vaccines we have given, 58% of the population got the vaccine, and almost 36% got data. Almost showing, and only 4% does cost under 40 each. And this is the situation. And vaccination front, we are actually, I would like the Honorable Minister mentioned, we will finish the first dose vaccine for the 18+ age group this month itself, hopefully. And this is the national versus the Kerala scenario. The most important advantage for Kerala is the case fatality rate. That is only hardly 0.5% only. At the national level, it is almost on 0.3%. That's the case fatality rate. And within the Kerala, in inter-district comparison, actually the mortality rate, the case fatality rate in Trivandrum districts is a concern for us, and that is a little bit high. Almost 0.97 is the case fatality rate in Trivandrum. And the most important thing, actually, in this group, we have to look into this thing. This is the most important thing. Almost 1/4 of the patients, actually, they are getting admitted, delayed admitted, or neither admitted or getting delayed in admissions. And almost 22.39% deaths. We already found that 1,800 deaths caused due to delay in admission. So the most important thing is, while they are observing this home isolation, they have to strictly follow the guidelines and the red flag signs. They have to stick to the red flag signs. And during the end of first week of onset of symptoms, if any red flag signs are shown, and if they have any comorbidities or any severe symptoms, they must be hospitalized as early as possible. This is the most important thing to avoid unwanted deaths, unnecessary deaths. Actually, we can prevent that. So comorbidities along with severe symptoms is the most important thing. And one more thing is, we have to make sure that all contacts should be traced out and should be tested, or with persons with symptoms should be tested out. So the contact tracing principle should be followed. And the contact, as we discussed in the past sessions also, it should be a face-to-face contact within 1 meter for 15 minutes. This is the ideal definition of a contact, defined by WHO, defined by CDC, and the Government of Kerala guidelines also defines like that. So this is the definition of a contact. And direct physical contact with probable or confirmed case, direct care for a patient without PPE, and other situations like traveling along with the confirmed case, like that. These are the things to define a contact. And transmission, as you know, 2 days before the onset of symptoms and 10 days after the symptom onset. And in a confined or closed space, with or without mask, there is a probability of, without proper masking, getting the infection is more. And as long as we are, the duration of, if we spend more time there, the risk of transmission is more. That's the thing. Now, regarding the quarantine principles, we have guidelines. Actually, there is no much difference. 14 days should be observed across globe. It is like that. Only thing is, interstate business travelers with stay less than a week have exempted for this quarantine 14 days. And there are variations in different states and different countries, slightly different in this kind of short stay travels, like that. Regarding testing, this is the most important thing changed in the recent days. One important thing is asymptomatic individuals who have taken 2 doses of vaccine and completed 2 weeks of vaccination, the second dose of vaccination, they need not test. That is the most important thing. They excluded from the testing guidelines. And COVID positive individuals with 2 months of positivity, they are also exempted. And introducing the RT-PCR again, that is another thing. For symptomatic patients, we have to do RT-PCR in the beginning itself. That is another change happened. All other things are all other things in the past, earlier guidelines, we are following the same thing. These are the changes. And regarding the home isolation as well as the discharge policies, most important change happened here is the number of days of home isolation changed from 17 days to 10 days. That is the most important change. And that we have to remember. All other things, we are following the same thing. If for mild and moderate cases, we have to follow 10 days isolation. If they are asymptomatic or mildly symptomatic. And one more thing we have to follow, we have to remember that there should be no symptoms for at least for 3 days before discharging. That is most important. If they have symptoms up to 10 days, we have to wait for 3 more days. That is the most important thing. So symptom-free 3 days should be there before discharging and onset of disease and discharge. And regarding the severe disease, we have to follow the earlier guideline, the same thing. 14 days, we have to test for the rat test we can conduct. Then again, we have to follow the thing. And 20 days observation is minimum for category C patients, severe cases. That is the most important thing. So regarding, I have to mention a few things about vaccines also. Currently, we are giving Covishield and Covaxins, two vaccines most important. Then Sputnik vaccine also in the market. 2 doses, 3 weeks apart is a dose interval for Sputnik vaccine. For Covaxin, it is 4 to 6 weeks is a dose interval, and Covishield, ideally, it should be 12 weeks is the most effective way to give the second dose. And regarding the vaccines for children, currently we have approved Zydus Cadilac's ZyCoV-D vaccine for 12 to 18 age group. That is, this is approved by the government, and Covaxin trials is going on for the 2 to 18 years age group. And one more vaccine was there, Covax by Serum Institute, that product of Novavax, for 2 to 17 years. But government, the expert committee, they currently denied permission for trials because they asked to complete the trials in the adult age group first, then we have to start this thing. And across globe, we know Pfizer vaccine is there, Novavax, Moderna vaccine is there for 12 to 17 age groups, currently using across globe. We know that. And regarding the vaccine effectiveness, actually, there are a lot of disputes, discussions are there, especially in the presence of Delta variant and newer variants. And we need not worry about that thing. The mortality is still very, very low in vaccinated people. And this should be an eye-opener for all of us. Vaccination offers higher protection than previous COVID-19 infection. That is most important thing. And unvaccinated people are 29 times more likely to be hospitalized with COVID. And mRNA vaccines reduce risk of infection by 91% for fully vaccinated people. These are the most important latest findings published by CDC. This is about vaccination advantages. And I'm winding this session right now. Thank you for your patient listening, and I will discuss if any questions or queries, we'll discuss later. Thank you very much.
Thank you very much, Dr. Altaf. Yeah. Can you please stop sharing the screen? Yeah, thank you very much. Yeah. Now we have Dr. Sajid Kumar. He was busy on an emergency call. That's why sir couldn't join early. Sir was there right from the beginning, and I'm extremely sorry for keeping you waiting, such a senior person. I need not introduce him. He is very, very familiar. And let me also say that we acknowledge the presence of our tall leaders, Dr. Babu Ravindran, Dr. Bhaskaran, Dr. C.K. Chandrasekharan, our guiding lights, Dr. V.G. Pradeep Kumar, Dr. A.V. Jayakrishnan, all our senior past presidents and leaders, Dr. K.V. Devadas, and all our the president-elect, Dr. Sulfi Nuhu, and all our important leaders. So thank you very much for joining us. Now let me request Dr. Sajid Kumar. He already had given an elaborate lecture in a previous meeting of ISAFE, and today sir will be highlighting especially the differences in a short lecture which we have requested from him. So over to you, Sajid sir.
Thank you, Dr. Srijit, for that beautiful introduction. Actually, I thought the session would be over by 9, so I had asked people to call me around 9 o'clock. So that's why I had to go out for a few minutes. Right. Respected President, Dr. P.T. Zakaria is my good old friend, Dr. Gopi Kumar. And as Srijit was rightly telling, it's like a homecoming for me to the old IMA house with a lot of old leaders there. And it will be so happy to share the screen with all of them. Now, I know it's getting too late, so I'll just quickly go through the guidelines. And in fact, I have put the label as rush through the guidelines because we'll be literally rushing through the guidelines only, because whatever change is happening, only we'll be highlighting. And before I go ahead, I must also put my appreciation for all the efforts by the ISAFE as well as PEPS and other agencies of IMA Kerala State Branch, as well as our overseas friends for carrying out the activities. I hope these activities will now get extended to the treatment part also, because it's now becoming more and more specific as the days are advancing. As all of us know, Dr. Altaf has rightly brought out the epidemiology part of it, so I'm not going to the epidemiology of any of the epidemiology aspects. So there are two main processes. One is actually the replication of the virus, and second is the body's inflammatory reaction. The first one is related to the viral replication. So antiviral therapies are going to be important there. The second one is because of immunosuppressive and anti-inflammatory therapies. So that is a different stage. Now, I'm not going to describe all the details of what is projected there, but if you look at the mild COVID, you can see that in about 10 days time, the infectiousness comes down, the inflammatory phase subsides, and the patient goes in for recovery. Whereas for severe COVID, as you can see, even beyond 2 weeks or 3 weeks, the hyperinflammatory process continues. And therefore, these patients are likely to develop complications. Complications in the form of shortness of breath, ARDS, coagulation disorder, which all of us are familiar now, patients landing in the ICUs. Now, we have got 5 strata of care, which has already been highlighted, where the patients are going to be handled in different situations. Now, there are various recommendations and guidelines which are available. I'm just quickly going through that. It is very easy to classify the patients into 3 or 4 groups. One is hospitalized patient, but does not require supplemental oxygen. And this is the type of patients who are just sick, but they don't need oxygen. And the panel of specialists from CDC as well as from IDSA recommends against the use of dexamethasone and other corticosteroids in this group. I'm just giving you only the summary. There is insufficient evidence to recommend either specialized use or routine use of remdesivir in these patients. Now, hospitalized patients requiring supplemental oxygen, these patients may benefit from a combination of dexamethasone plus remdesivir, or remdesivir alone, or sometimes even dexamethasone alone. Hospitalized and requiring oxygen therapy through a high flow device, these patients are likely to benefit from all the previous treatments that we mentioned, dexamethasone plus remdesivir, or only baricitinib or tocilizumab, about which we'll be discussing a little later. Hospitalized and requiring extensive, intensive ventilation, like intensive mechanical ventilation, invasive mechanical ventilation, or ECMO. For these patients, only dexamethasone or tocilizumab is recommended. So just to summarize, whatever we have learned in the first phase, whatever we have learned in the initial days of the second phase, all these drugs are out now. So we are not going to use any of those drugs, including even ivermectin, that has been pushed out of all the recommendations. And I would suggest that even favipiravir is on the way out from all guidelines and recommendations. Corticosteroids are recommended only in hospitalized patients who require supportive treatment with oxygen and other things. Now I'll just quickly come through the differences that has happened. From the first wave, we were all using repurposing drugs, off-label drugs, EUA and all those things. And second wave, we know what does not work. So all these things are out now. What stands specifically? Isolation, infection control, general care, steroids, anticoagulation, and oxygen. Monoclonals are coming back. Monoclonals have been used for various diseases in the past, as it is written there. And they have all been found to be useful in the control of very, very difficult diseases. But what has come back in the field of COVID management is this particular combination or cocktail of 2 antibodies, casirivimab and imdevimab, which has actually been the original drug which was popularized by Donald Trump when he became sick. And as all of us know, this is a cocktail of 2 different monoclonal antibodies, which has been chosen from more than 200 neutralizing monoclonal antibodies, which has been isolated from humanized mice as well as the sera of patients recovering from COVID-19. And these 2 are used because they bind to different parts of the receptor binding domain of the S protein of the virus. And once they get attached to these 2 different parts, it's almost impossible for the virus to survive and enter any other cell. Not only that, by the attachment of these particular monoclonal antibodies to the receptor binding protein of the S protein, these viruses will not be able to attach to other cells, and those cells which have been infected by the virus already will be destroyed by antibody dependent cell mediated immunity, and that will be the ultimate control of the viral numbers in the patient's body, which means the virus will not be able to replicate, the virus infected cells will be destroyed, and thereafter all the effects of the viral replication will be nullified by these 2 monoclonal antibodies. As all of us are familiar now, these are the 2 antibodies that we use, which bind specifically, and they are able to act in different ways. Now, whom are we going to give this? Very specific indications, because this is a costly drug. One injection is supposed to cost around 1,20,000 rupees, which can actually be shared with 2 individuals, and the cost can be brought down to 60,000 rupees per person. And this is recommended for use in those patients who are not going to be hospitalized. And in those patients who have got various significant comorbidities which are likely to make them sick in the future. Or in other words, these are going to be used in majority of individuals who can be managed on an OP basis. Unfortunately, that happens to be our majority patients also. So you are not going to use this in every patient, but we are going to use this only in those high-risk individuals who will benefit from that. And the criteria is already written there. Patients who are obese, patients who are having uncontrolled diabetes mellitus, significant chronic kidney disease, significant chronic liver disease, age more than 65 years, malignancies with a chance of survival, and similar immunocompromising situations. It should not be administered in patients who require oxygen therapy, those who are on oxygen therapy due to an underlying COVID-related comorbidity, and in patients who are more than 10 days in the symptom onset. So this drug, this cocktail is actually the major change that has happened since the last guideline to this guideline. The dosage is 600 milligrams of both these drugs administered together as a single intravenous infusion over at least 60 minutes. And this must always be given only in a hospitalized environment, and this is not to be administered in domestic surroundings. In dire emergencies where you cannot give this intravenously, or in situations where you are fearing IV drug reactions and other things, drip reactions and other things, this can be administered subcutaneously. And as I said before, this is one of the earliest drugs to be given as soon as possible after the positive results of the testing is available. There is insufficient data in pregnancy, but we know that this immunoglobulin can cross the placenta, but the fetal test has not been studied. But still, this may be tried with concern in these individuals. So the guidelines, this has been incorporated into the state government guidelines, which has come up in August 2021, which actually strategizes treatment according to the clinical categorization and risk stratification. I'm not going to the details of all those things. We know about the earlier classification of mild, moderate, and severe. But in addition, we have now added another one, which is critical illness, which is requirement of high-level respiratory support, non-invasive ventilation, high-flow oxygen, etc., going on to invasive mechanical ventilation, or ARDS, or sepsis or shock. Now, therefore, we have recommendations also based on that. Again, I'm not going to the details of all these things for want of time, but just to tell you that in patients who are in category A, only symptomatic treatment. In category B, inhalational budesonide is recommended, but these are the patients in whom, if they belong to the high-risk category, we are going to give the monoclonal antibodies. Category C and category D, there has not been category C and category C severe disease. There has not been much modifications in the management. So I'm not going to the details of all those things. The other change that has come up is the use of remdesivir. Remdesivir is now recommended only in category C, moderate and severe disease requiring supportive oxygen within 10 days of symptom onset again, with no renal or hepatic dysfunction. Dosage is the same as before, 200 milligrams on IV on day 1, followed by 100 milligrams daily for the next 4 days. The other recommendation change that has happened is for tocilizumab, which again is a monoclonal antibody, which has got a very specific anti-IL-6 effect and is also a serious immunosuppressant drug. This is recommended in patients who are recently hospitalized. They say that preferably within the last 24 hours and who require invasive mechanical ventilation, in whom remdesivir is not indicated or remdesivir is contraindicated, or in patients in whom they could not give monoclonal antibodies, and also in patients who are recently hospitalized with rapidly increasing oxygen needs. But remember, this is a very serious immunosuppressant drug, so this must be used with more caution than we use steroids. Then the other group which has now come into the guideline is the Janus kinase inhibitors, which is actually a family of intracellular non-receptor tyrosine kinase inhibitor, which was labeled as just another kinase, and the name came from that. They called it as Janus kinase for that. And there are two drugs which are commonly used, baricitinib and tofacitinib. They prevent phosphorylation of key proteins, and they interfere with the vital cellular functions, so that the effect of the virus on the immune mediation is blocked. And this is the major advantage for this particular drug is that this can be administered as an oral drug. 4 milligram once daily, the cost of which was prohibitive in the beginning, but which has come down now to the tune of only around 1,000 to 2,000 rupees for a course of treatment. And this is to be given for a period of 7 to 14 days. But again, because this is a monoclonal drug and because this is likely to have more significant immunosuppressive effects, this should not be administered in patients who have received tocilizumab. And there are contraindications also, like if the patient's lymphocyte count is low, if there are active serious infections, active tuberculosis, and combination with other immunosuppressant drugs, pregnancy, patients who are on dialysis, patients who are having cardiac problems are not to be given these JAK inhibitors. Just for completion's sake, the Indian drug which has come into the field, the 2-deoxy-D-glucose, is again recommended. It's a synthetic glucose analog. It's recommended as an adjunct therapy in moderate to severe COVID-19 patients. This particular carbohydrate moiety or the glucose moiety gets accumulated in the virus infected cells and prevents the virus growth by stopping the viral synthesis and energy production. And remember, this is an Indian drug, a cheap alternative, but not to be used in pregnancy. Studies are not there, not enough studies below the age of 18 years, and in patients who are having uncontrolled diabetes mellitus. And then along with those drugs, which can have cardiac effects. It's a very simple drug, 45 milligrams per kilogram body weight, given as a powder, dissolved in drinking water twice daily. And patients are required to be taking it preferably in a fasting mode. The new drug which has come into the market, or which is probably coming into the market very soon, is a drug called Molnupiravir, which is actually a drug which has been found to be of very significant use in reducing the viral load effectively with RT-PCR negativity, where the viral load can be brought down to something like 78.3% in the first 5 days. Well, we are waiting for these drugs to enter our market. So these are the major changes which has happened in the guidelines. And because of lack of time, I am not going to discuss anything about post-COVID syndrome, which we will discuss probably at some other time. And also about the multi-inflammatory syndrome in children and adults, which again is likely to pose problems for us. But I'm not again going to touch on that because we have got definite guidelines, recommendations there. I'm sure all of you must be able to follow the standard simple recommendations put out by the government of Kerala. For MIS, there is no specific standardized treatment except giving immunosuppressants like methylprednisolone or IVIG. And in refractive cases, again, we may have to go for monoclonal antibodies. The two other issues associated where guidelines have not changed much, but of important concern to us are in the field of Kappa and CAM, and that is COVID-associated pulmonary aspergillosis and COVID-associated mucormycosis. Again, requires a lot of time to discuss about those things, so I'm not venturing into that area. The other one is one major recommendation that has come up is to reduce the number of HRCTs. This is of concern to most of us who are practicing, because a large number of patients are now submitted to HRCT test unnecessarily. And now why this is not needed? Because it's not going to produce any significant change in the clinical management. HRCT imaging done in the first week of the illness might underestimate the extent of lung involvement. The correlation with HRCT and the lung involvement is not thought to be as perfect as we thought earlier. We have to avoid repeated radiation exposure to these patients, and a large number of patients who have abnormalities which are non-specific. Now, because of these reasons, usage of HRCT is also now being discouraged in the context of the new guidelines. So I'm just concluding my talk just with a one slide which tells us how important it is to get vaccinated. Dr. Altaf has very rightly pointed out the importance of vaccination. And in fact, compared to all other treatment guidelines, what we have to keep on projecting is the value about being vaccinated, which will definitely reduce hospitalization and will reduce the need for all these drugs and guidelines. Thank you very much.
Thank you very much, sir, for that very exciting introduction. And we'll have more lectures by you. And before we wind up, let me just make some quick announcements. Sir, can you please stop sharing the screen? Thank you very much. Now, for all the ISAFE members, let me just make some quick administrative announcements before we wind up. നമ്മുടെ ഈ ഐസേഫിന്റെ ഇപ്പോഴത്തെ ഫേസിൽ നമുക്കറിയാം കോവിഡ് തുടർന്നുകൊണ്ടിരിക്കുകയാണ്. അപ്പോൾ വാക്സിനേഷൻ വളരെ വളരെ പ്രധാനമാണ്. സ്മോൾ ആൻഡ് മീഡിയം ഇൻസ്റ്റിറ്റ്യൂഷൻസും വാക്സിനേഷൻ നൽകേണ്ടി വന്നേക്കും. അപ്പൊ അതിന് നെസസറി സാങ്ഷൻ DMOയുടെ ഭാഗത്ത് നിന്ന് ആവശ്യമുണ്ട്. അപ്പൊ നിങ്ങളുടെ ഓരോ ജില്ലയിലെയും അതിന്റെ RCH ഓഫീസർ, സർവൈലൻസ് ഓഫീസർ ഉണ്ട്. അപ്പൊ അവരുമായി ബന്ധപ്പെടണം. അവരുമായി ബന്ധപ്പെട്ടിട്ട് സാങ്ഷൻ എടുക്കണം. ആൻഡ് എത്ര വാക്സിൻ ആവശ്യമുണ്ടെങ്കിലും, നേരത്തെ ഡോക്ടർ ദിലീപ് പറഞ്ഞു, അത് ചെറിയ നമ്പർ ആണെങ്കിലും വലിയ നമ്പർ ആണെങ്കിലും KMSCL നിന്ന് അത് പ്രൊക്യൂർ ചെയ്യാൻ സാധിക്കും. അപ്പോൾ നിങ്ങൾക്ക് നമ്മുടെ ഐസേഫിന്റെ ജില്ലാ കൺവീനറുമായിട്ട് ബന്ധപ്പെടാം. അല്ലെങ്കിൽ നമ്മുടെ ഐസേഫിന്റെ ഡിമാൻഡ് പ്ലേസ് ചെയ്യാനുള്ള നമ്പേഴ്സ് നിങ്ങൾക്ക് അറിയാം. 8078478278. അല്ലെങ്കിൽ pepsmedhelp@gmail.com അതിലേക്ക് നിങ്ങളുടെ ഡിമാൻഡ് അയക്കാം. So we will connect you directly with KMSCL, and PEPS is not doing anything other than connecting you directly with KMSCL. You can make the payment direct to KMSCL and procure it directly from their warehouses. അപ്പോൾ അതാണ് ഒരു കാര്യം. രണ്ടാമത്തെ കാര്യം, നമ്മുടെ അടുത്ത സെറ്റ് ഓഫ് പിന്നെ N95 മാസ്ക്സ്, FFP2 മാസ്ക്, അതുപോലെ സാനിറ്റൈസേഴ്സ് നമ്മൾ എല്ലാ ഐസേഫ് മെമ്പേഴ്സിനും ഡിസ്ട്രിബ്യൂട്ട് ചെയ്യും. അതുകൂടാതെ നമ്മൾക്ക് ഇന്നലെ വരെ പല ബ്രാഞ്ചുകളിൽ നിന്ന് ഗവൺമെന്റ് ഇൻസ്റ്റിറ്റ്യൂഷൻസിനെ ഡിസ്ട്രിബ്യൂട്ട് ചെയ്യാനുള്ള റിക്വയർമെന്റ് വന്നിട്ടുണ്ട്. അപ്പൊ അവർക്ക് കൊടുത്തിട്ട് മിച്ചം ഉണ്ടെങ്കിൽ മാത്രമേ ഇനി നമുക്ക് ബ്രാഞ്ചസിനെ എന്റർടൈൻ ചെയ്യാൻ സാധിക്കുള്ളൂ. കാരണം ഇപ്പൊ തന്നെ നമുക്ക് നൽകാവുന്നതിലധികം ഡിമാൻഡ്സ് ആണ് നമുക്ക് വന്നിരിക്കുന്നത്. അപ്പൊ ഏതായാലും വേറെ ഒരു കൺസൈൻമെന്റ് കൂടി നമ്മൾ ഉടൻ തന്നെ പ്രതീക്ഷിക്കുന്നുണ്ട്. ഒരു 2 ആഴ്ചക്കുള്ളിൽ കുറച്ച് PPE കിറ്റ്സും ഗൗൺസും മറ്റ് കുറച്ച് എക്യുപ്മെന്റ്സും കൂടി നമുക്ക് വേറൊരു സോഴ്സിൽ നിന്ന് കൂടി ലഭിക്കാൻ സാധ്യതയുണ്ട്. അങ്ങനെയാണെങ്കിൽ ബാക്കിയുള്ള ഡിമാൻഡ്സ് കൂടി നമുക്ക് ചെയ്യാൻ പറ്റുമോ എന്ന് നോക്കാം. ചില സർക്കാർ ആശുപത്രികളിൽ നിന്ന് സ്പെസിഫിക് ആയിട്ടുള്ള ചില റിക്വയർമെന്റ്സ് വന്നിട്ടുണ്ട്. പ്രത്യേകിച്ച് PT സെക്രട്ടറി സാറ് അദ്ദേഹം ആലപ്പുഴ ജില്ലയിലേക്കുള്ള ചില റിക്വയർമെന്റ്സും പറഞ്ഞിരുന്നു. അപ്പൊ അത്തരം റിക്വയർമെന്റ്സ് കൂടി ഈ ഘട്ടത്തിൽ നമുക്ക് കഴിയുന്നിടത്തോളം കൊടുക്കാൻ ശ്രമിക്കുന്നതാണ്. പിന്നെ നമ്മുടെ പൾസ് ഓക്സിമീറ്റേഴ്സ് ഡിപ്ലോയ് ചെയ്തിട്ടുണ്ട്. അപ്പോൾ പിന്നെ കോവിഡ് ഇപ്പോഴും തുടരുന്നുണ്ടെന്ന് നമുക്കറിയാം. അതുകൊണ്ട് എല്ലാ ജില്ലകളിലുമുള്ള പൾസ് ഓക്സിമീറ്റേഴ്സ് ദയവ് ചെയ്ത് ആക്റ്റീവായിട്ട് ഡിപ്ലോയ് ചെയ്യണം. ആർക്കെങ്കിലും പേഷ്യൻസിന് ആവശ്യമുണ്ടെങ്കിൽ നമ്മൾ അത് കൊടുക്കുകയും വേണം. പിന്നെ മറ്റെന്ത് ആവശ്യത്തിനും സഹായത്തിനും pepsmedhelp@gmail.com നിങ്ങൾക്ക് മെസ്സേജ് അയക്കാം. എന്തെങ്കിലും പരാതികൾ ഉണ്ടെങ്കിൽ pepsresolve@gmail.com അതിലേക്ക് അയക്കണം. പലപ്പോഴും ഈ കറക്റ്റ് ഇമെയിൽ ഐഡിയിലേക്ക് വരാത്തത് കൊണ്ടാണ് പലപ്പോഴും ഇത് റിസോൾവ് ചെയ്യാൻ പറ്റാതെ പോകുന്നത്. ആൻഡ് നമ്മളൊരു വലിയ ഡിമാൻഡാണ് നമ്മൾ ഇത് ചെയ്താൽ പ്യൂർലി വോളണ്ടറി ആണ് ഈ എഫേർട്സ് എല്ലാം. ഇപ്പോ പിന്നെ നമ്മുടെ സിറിയക്ക ആണെങ്കിലും, അതുപോലെ മധു സാർ ആണെങ്കിലും, ബിലായി ആണെങ്കിലും, രാജേഷ് ആണെങ്കിലും, അതുപോലെ നമ്മുടെ ജില്ലയിലുള്ള ഓരോ പെപ്സിന്റെ ഓഫീസ് ബെയറേഴ്സ് വളരെ നിസ്വാർത്ഥമായിട്ടുള്ള സേവനമാണ് നടത്തിക്കൊണ്ടിരിക്കുന്നത്. അപ്പൊ ചില ഭാഗത്തു നിന്നൊക്കെ ചിലപ്പോ പരുഷമായിട്ടുള്ള രീതിയിലുള്ള ചില പരാമർശങ്ങളൊക്കെ ഉണ്ടാകുന്നുണ്ട്. അപ്പൊ അത് ചെയ്യരുത്. കാരണം നമ്മുടെ തന്നെ പ്രൊഫഷണൽ കൊളീഗ്സ് നമ്മളെ ഹെൽപ്പ് ചെയ്യാൻ വേണ്ടിയാണ് ഇത് ചെയ്തുകൊണ്ടിരിക്കുന്നത്. അപ്പൊ അത് മനസ്സിലാക്കണം. എന്തെങ്കിലും ചെറിയ ബുദ്ധിമുട്ടുകൾ ഉണ്ടാകാം. കാരണം ഒരു വലിയ മെഗാ പ്രോഗ്രാമാണ് നമ്മൾ ചെയ്യുന്നത്. അപ്പൊ അത്തരത്തിൽ ബുദ്ധിമുട്ടുകൾ ഉണ്ടാവുകയാണെങ്കിൽ തീർച്ചയായിട്ടും pepsresolve@gmail.com നിങ്ങളുടെ കംപ്ലൈന്റ് അയക്കുക. ഡോക്ടർ സിറിയക്ക് ഇമ്മീഡിയറ്റ്ലി അതിന് റിപ്ലൈ ചെയ്യാറുണ്ട്. 48 hours ആണ് നമ്മൾ ചോദിക്കുന്ന സമയമെങ്കിലും ഞാൻ പലപ്പോഴും കാണാറുണ്ട് വിതിൻ 4 hours തന്നെ ഡോക്ടർ സിറിയക്ക് അതിനെ റിസോൾവ് ചെയ്യാൻ ശ്രമിക്കാറുണ്ട്. അപ്പൊ തുടർന്നും അതുണ്ടാകും. എന്ത് പ്രശ്നമുണ്ടെങ്കിലും നമ്മളെ അത് അറിയിക്കുക. കൂടുതൽ കാര്യങ്ങൾ നമ്മൾ നിങ്ങളിലേക്ക് എത്തിക്കും. മാത്രമല്ല സജിത് കുമാർ സാറിന്റെയും അതുപോലെ ഡോക്ടർ അൽത്താഫിന്റെയും മറ്റ് എക്സ്പേർട്സിന്റെയും ഒരു ലെവൽ ഓഫ് CMEയും കൂടി വിതിൻ 2 or 3 weeks നമ്മൾ നടത്താൻ ആലോചിക്കുന്നുണ്ട്. അപ്പൊ ഇന്ന് ഒരുപാട് അഡ്മിനിസ്ട്രേറ്റീവ് പ്രോഗ്രാംസ് ഉണ്ടായിരുന്നത് കൊണ്ടാണ് ഇത് നീണ്ടുപോയത്. അപ്പൊ അതുകൊണ്ടാണ് നമുക്ക് ഈ അക്കാഡമിക് പ്രോഗ്രാം കുറച്ചൊന്ന് ഷോർട്ടൺ ചെയ്യേണ്ടി വന്നത്. ബട്ട് വളരെ ഇലോബറേറ്റ് ആയിട്ട് നമ്മുടെ ഫാക്കൽറ്റിയിൽ നിന്ന് വീണ്ടും നമുക്ക് ലെക്ചർ ഉണ്ടാകും. ആർക്കെങ്കിലും എന്തെങ്കിലും അത്യാവശ്യം പറയാനുണ്ടെങ്കിൽ ഒന്നുകിൽ ചാറ്റ് ചെയ്യുകയോ അല്ലെങ്കിൽ അൺമ്യൂട്ട് ചെയ്ത് ഇപ്പൊ പറയുകയോ ചെയ്യാം. പ്രത്യേകിച്ച് ഞാൻ നേരത്തെ പറഞ്ഞു, നമ്മുടെ ബഹുമാനപ്പെട്ട പാസ്റ്റ് പ്രസിഡൻസ്, നമ്മുടെ ബഹുമാനപ്പെട്ട സ്റ്റേറ്റ് പ്രസിഡന്റ്, സ്റ്റേറ്റ് സെക്രട്ടറി വലിയ പ്രോത്സാഹനവും എൻകറേജ്മെന്റും മാർഗനിർദ്ദേശവുമാണ് നൽകിക്കൊണ്ടിരിക്കുന്നത്. അഗൈതമായ നന്ദി ഞാൻ രേഖപ്പെടുത്തുകയാണ്. നിസ്വാർത്ഥമായിട്ടുള്ള സേവനങ്ങൾ നമ്മുടെ എല്ലാ ഡിസ്ട്രിക്ട് ലീഡേഴ്സും അതുപോലെ സ്റ്റേറ്റ് ലീഡേഴ്സും കാഴ്ചവെക്കുന്നുണ്ട്. അതിനും ഞാൻ നന്ദി രേഖപ്പെടുത്തുന്നു. ഔപചാരികമായി നന്ദി രേഖപ്പെടുത്തുവാൻ നമ്മുടെ പെപ്സ് ട്രഷറർ കൂടിയായ ഡോക്ടർ ബിലായി ഒരു വലിയ എഫേർട്സ് ആണ് ബിലായുടെ ഭാഗത്ത് നിന്ന് ഇതിനുണ്ടായിക്കൊണ്ടിരിക്കുന്നത്. ഞാൻ രാജേഷിനെയും അതുപോലെ മധുസാറിനെയും ചുമതലപ്പെടുത്തിയിരുന്നു ക്വസ്റ്റ്യൻസ് ആൻസർ ചെയ്യാൻ. പക്ഷെ നമ്മൾ തീരെ വൈകി പോകുന്നതുകൊണ്ട് നമ്മൾ നീട്ടുന്നില്ല. വീണ്ടും ഒരു അക്കാഡമിക് സെഷൻ തീർച്ചയായിട്ടും നമുക്ക് ഉണ്ടാകുമെന്ന് പ്രോമിസ് ചെയ്യുന്നു. ആൻഡ് ഡോക്ടർ ബിലായിയെ ഔപചാരികമായി നന്ദി രേഖപ്പെടുത്തുവാൻ ക്ഷണിക്കുന്നു.
A very good evening to all. Today we had yet another important session of iShape initiative. And now it is time for the vote of thanks. At the onset, let me thank our Health Minister for inaugurating today's session, and she has been a great supporter of our iSafe program. And next, on behalf of IMA, I extend our sincere gratitude to Dr. Ilangovan IAS for his very interesting talk. And next, I would like to express my hearty thanks to our own State President, Dr. Sakriya Sir, as well as State Secretary Gomar Sir for all the support extended to iSafe program. Next is Dr. Dilip Kumar of KMCL. On behalf of ISAF, I extend our gratitude for his help in facilitating supply of vaccination to our ISAF member hospitals. And next, I would like to praise on record our gratitude to Dr. Sandeep and Dr. Mahesh for introducing the Covina mask, and also Mr. Prem Parameswaran of especially, and as well as all the other members of Singapore Malayali Association for all their support. And okay, sir. And we had two very important lectures today, very interesting lectures, very updates. And I thank our faculty members, Dr. Sajid Kumar sir, as well as Dr. Altaf, for the excellent updates on the COVID. And before I wind up, I express my sincere gratitude to all the leaders of IMA who have attended today's meeting, as well as all my ISAF members who are have been very supportive for all our activities. And with this note, I conclude. Thank you all, one and all.
Thank you very much, Bilai. Now we have a 0 set 0 hour. So all leaders may ഇനിയിപ്പോ നമുക്ക് കമ്പൽസറി അല്ല, ബട്ട് സ്റ്റിൽ ഐ വുഡ് റിക്വസ്റ്റ് എല്ലാവരും കുറച്ചൊന്ന് 5-10 മിനിറ്റ് കൂടെ ഒന്ന് ഇരിക്കണം. നമ്മുടെ ലീഡേഴ്സിനെയൊക്കെ നമുക്കൊന്ന് കേൾക്കണം. CKC സർ. ഓ കേൾക്കാം. ശാലം വോളിയം കൂട്ടിയാൽ യുവാവ് പറയുന്നത് കുറച്ചുകൂടെ ക്ലിയർ ആകും.
വളരെ multiple program arranged, special as well as top by 2 faculties. It was very much useful. Thank you very much. Dr. Sridhar എപ്പോഴും നോവൽ ഐഡിയാസ് അങ്ങനെ തോന്നും, മനസ്സിൽ തോന്നും. അപ്പോൾ തന്നെ അദ്ദേഹം ഒരു ആപ്റ്റായിട്ട് ഒരു പേര് കൊടുക്കും. അത് നടത്തിക്കാൻ എക്സിക്യൂട്ട് ചെയ്യാൻ ശരിയാക്കുമ്പോൾ ആ ഹോൾ ടീം ഉണ്ടായിരുന്നു. ഇതൊന്ന് ശരിയാക്കുമ്പോൾ ഇപ്പൊ നമ്മുടെ പേപ്പേഴ്സിന് മറപ്പുകേട് തീർച്ചയായിട്ടും ഒരു വിടവായിരിക്കും. ഒരു നാള് തീർച്ചയായിട്ടും അത് മേക്കപ്പ് ചെയ്ത് ഞാൻ ഇപ്പോഴത്തെ വളരെയധികം സന്തോഷം എന്ന് വെച്ചാൽ ഡോക്ടർ ഇളങ്കോവനെ കണ്ടത്. ഡോക്ടർ ഇളങ്കോവൻ വാസ് കളക്ടർ ഹിയർ അറ്റ് പാലക്കാട്. Then I was superintendent this hospital in Palkar. I don't know whether he remember me or not. Years back he was happened and he was very much helpful to us. ഇപ്പോൾ ഓർമ്മയുണ്ട്, ഒരു കുട്ടനാട് ഒരു ഹോസ്പിറ്റൽ അറ്റാക്ക് വന്നപ്പോൾ അറ്റാക്ക് നടന്നപ്പോൾ രാത്രി 12 മണിക്ക് ഞാൻ അദ്ദേഹത്തെ വിളിച്ചിരുന്നു. അദ്ദേഹം എല്ലാ ഹെൽപ്പും വളരെ വെർച്വൽ മീറ്റിംഗിൽ കൂടെയാണെങ്കിൽ അദ്ദേഹത്തെ കാണാൻ സാധിച്ചതിൽ എനിക്ക് വളരെയധികം സന്തോഷമുണ്ട്. വളരെയധികം വൈകിയതുകൊണ്ട് താങ്ക് യു.
Thank you very much, sir. Any other leader who would like to speak may kindly unmute. Now you can unmute yourself.
Dr. Jayakrishan.
Oh, JK.
അല്ല, ഇതിൽ റെസ്പെക്ടഡ് പ്രസിഡന്റ് PT Secretary sir and all the senior leaders. ഇത് ശരിക്കും ഒരു നമ്മുടെ ഈ മുതുകാടിന്റെ മാജിക് കാണുന്നത് പോലെയാണ്. കാരണം ശ്രീജിത്തിന്റെ ഓരോ പ്രോഗ്രാമിന്റെ ഓരോ ദിവസവും കുറെ ഒരു തൊപ്പിയിൽ നിന്ന് കുറെ അത്ഭുതങ്ങളാണ് പുറത്തേക്ക് വരുന്നത്. വളരെയധികം പാക്ഡ് ആയിട്ടുള്ള കാര്യങ്ങൾ, ഇൻഫർമേഷൻ, പ്രോഗ്രാംസ്, അതുപോലെ മെമ്പേഴ്സിന് ഏറ്റവും ഉപകാരപ്രദമായ ഒരുപാട് കാര്യങ്ങൾ. ഇത്രയും കാര്യങ്ങൾ കോർത്തിണക്കിക്കൊണ്ട് തുടർച്ചയായി 2 വർഷം ഒരു പ്രോജക്റ്റ് നയിക്കുക എന്നുള്ളത് വളരെ ബുദ്ധിമുട്ടും ആയാസകരവുമായ ഒരു കാര്യമാണ്. പക്ഷേ വളരെ നിസ്സാരമായിട്ടും ഏറ്റവും എളുപ്പത്തോടും കൂടി ഈ ടീം അത് നിർവഹിക്കുന്നു. ശ്രീധരന്റെ നേതൃത്വത്തിൽ, അതുപോലെ സിറിയക്, ബിലായി, മധു, ഡോക്ടർ മധു, അങ്ങനെ എല്ലാവരുടെയും നേതൃത്വത്തിൽ ഈ ടീമിനെ ഏറ്റവും ആത്മാർത്ഥമായി ഹൃദയപൂർവ്വം കൺഗ്രാജുലേറ്റ് ചെയ്യുന്നു. താങ്ക് യു.
Thank you very much, JK. Thank you very much.
ഒരു മിനിറ്റ്, ഈ ജയകൃഷ്ണൻ അതിനേക്കാൾ കൂടുതൽ ലോഡ് എടുക്കുന്നുണ്ട്.
എക്സാക്ട്ലി. JK ബിഹൈൻഡ് ദ കർട്ടൻ ആണ്. JK ചെയ്യുന്ന പല കാര്യങ്ങൾ ദേശീയ തലത്തിലും അതുപോലെ സംസ്ഥാന തലത്തിലും വലിയ ബ്രില്യന്റ് ലീഡർഷിപ്പ് ആണ് JK കൊടുത്തുകൊണ്ടിരിക്കുന്നത്. താങ്ക്സ് a lot, JK. ദേവദാസ് സർ.
Thank you, sir. Respected President and dear IM brothers and IM sisters. ഇത് ശ്രീജിത്തും സിറിയക്കും ആ ടീമും ചെയ്യുന്ന കാര്യങ്ങളെല്ലാം തന്നെ 2 കൊല്ലം ചെയ്ത കാര്യങ്ങള് IMA-യുടെ ചരിത്രത്തിൽ സ്വർണ്ണലിപികളിൽ എഴുതി വെക്കണമെന്നാണ് എനിക്ക് പറയാനുള്ളത്. എല്ലാവിധ ആശംസകളും സ്വർണ്ണലിപികളിൽ എഴുതി വെക്കണം.
താങ്ക് യു. കുന്നംകുളത്ത് എക്യുപ്മെന്റ്സ് എല്ലാം ഉണ്ടാക്കി തരണമെന്ന് അഭ്യർത്ഥിക്കുന്നു. Please, sir, please.
ശ്രീജിത്തിന്റെയും ഈ പരിപാടി ലോകത്തിലെ ക്രിയേറ്റിവിറ്റിയുടെയും ലീഡർഷിപ്പിന്റെയും ഏറ്റവും ഉദാത്തമായ എക്സാമ്പിൾ ആണ്. ഈ വർഷങ്ങളോളം ഇത് തുടർന്ന് ഇനിയും തുടരാൻ സാധിക്കുമെന്നാണ് എന്റെ പ്രതീക്ഷ. എല്ലാ ഭാവവും നേർന്നത്.
Thank you very much, sir. So I think probably നമുക്ക് സമയമായിരിക്കുന്നു. And so thank you very much to all our distinguished leaders, our very, very committed members, our state president, state secretary, all of you, and for all our sponsors for making this venture happen. So thank you very much. We'll see you again soon. Good night.